Will you raise your right hand, please? All right, doctor, it's very important that you stay close to that mic within a couple inches so it picks up your voice, okay? And you can bend that down if you want to make it a little lower. All right?
Yes, sir.
Morning, Doc.
Morning.
How are you doing this morning? Okay.
Fine, thank you.
Doctor, we've met before, correct?
True.
This is the third time I'm taking your testimony.
Yes.
Other than when I've taken your testimony, you and I have not met, correct?
Correct.
We never met to discuss your testimony or discuss this case, correct?
Correct.
For the record, Doctor, could you have your full name, please?
Shri Nivas Lele.
Pronounce your last name for me.
Lele. L-E-L-E.
Lele. Am I pronouncing that correct? I've had some trouble.
Correct.
And Doctor, what's your current home address?
3400 Old Brainerd Road, Paper Pike, Ohio.
And what type of physician are you?
Internal medicine.
Doctor, I wonder if you could give the ladies and gentlemen of the jury a little bit of an idea about your medical background, your educational background.
I did my basic degree in India. Then I went to United Kingdom, worked in National Health. I was ENT surgeon. I'm diplomat of Royal College of Surgeons. Then I came to United States. I did my residency, Fairview Clinic program, finished it in 1999. Since then, I'm employed physician with University Hospital. Almost now worked about 25 years at same spot.
Okay, what year did you come to this country?
1996.
Doctor, I know that I'm asking you the questions, but as much as you can, if you direct your attention to the jury, so they can make sure we hear them and they see you, okay?
I will
As
try.
much as you can. I know it's.
I will try.
So Doctor, your employer in 2018 was University Hospitals, correct?
Yes.
Can you tell us, the jury, a little bit of idea what your medical practice was like back in 2018?
They call me now old-fashioned internal medicine doctor who does office, hospital, nursing home. So I see my own patient in hospital, office, and nursing home. So whatever internal medicine normal doctors do, that I did.
So I believe you also have an office-based practice, correct?
Yes.
Just tell the jury what your week would be like, Monday through Friday. Give them an idea of what your practice is like.
Monday to Friday, I have everyday office hours, which usually 8 to 5, except Thursday, 12 to 7 or 12 to 8 in the afternoon. Saturday, every other Saturday, that's office. And then morning and evening, at that time I used to do hospital medicine as well. Morning and evening, and weekends I do nursing home rounds.
Okay, you use the term hospital medicine. You used to do it before your office hours and after your office hours during the week. What do you mean by hospital medicine?
Admitting patients, discharging them, follow them everyday basis, because my patients like that. They want their own doctors to make the rounds. And this is old. We all did it years ago.
Okay. And we'll come back to that. You mentioned you also have patients in nursing homes.
Yes.
What's your nursing home practice like that?
Well, I make rounds in nursing homes, see the patients regularly, every month or every week if they are taking rehab. Whatever guidelines by the Medicare and the University Hospital, we have to see the patients and take care of them.
So are these your private patients or are these patients that are assigned to you?
They all belong to University Hospital, and everything flows through my employer. I have no practice outside University Hospital.
Okay. So you may see a patient in a nursing home that you've seen in the office before, correct?
Correct,
Or you may see a patient for the first time in the nursing home.
correct,
Likewise, at the hospital, you may see a patient in the hospital that you've seen before in your private practice.
correct,
Or you may see a patient you've never seen before that University Hospital has asked you to see.
correct, especially if I'm on call.
Doctor, what nursing facilities do you practice at?
Well, in 2018, I was going to the Alter Care of Mentor, and now they call it Core Call Mentor Way, Wycliffe Country Place, and few of them.
And what hospitals did you practice?
I went always to Tri-Point Hospital and Lake West Hospital.
Did you have privileges at any other facilities other than Lake West and Tri-Point?
I believe at that time I also went to the Ahuja Hospital.
Did you go there much?
No.
And as far as Tri-Pat and Lake West, what were the extent of the privileges that those hospitals extended to you?
At that time, I was practicing full medicine, and I believe that was before the COVID. So we were doing everything, ICU medicine, regular medical floor, admission, discharge, follow-up, full privileges at that time.
All right, so admit patients, discharge patients,
Yeah,
and follow patients.
every day, yes,
You do not perform surgery, correct?
no.
Doctor, is your practice basically the same today?
Yes, except I'm doing less hospital.
Less hospital? Okay, why is that?
Because system wants me to do more office. There's a big shortage in the office.
And when you say the system, that's UH.
My employer, yeah.
So Dr. Keith, let's talk about your hospital practice then back in 2018. Could you tell the jury how it is that you would get a patient at Tri-Point Hospital? How the process worked?
Well, it used to be, for example, patients come in my office or family called, they are sick. We could direct admit them under our practice. Most of patients we know. But that was kind of, I would say, much less percentage. Mostly the patient shows up in emergency room either on their own will or 911, and then emergency room will triage them, stabilize them, decide to admit, then they will call us, and we will take the call, admit patients, put the admission orders. Computer was just coming in, when the computer was there, and then we go and see them. We are required to see them. If they're in ICU at that time, within 4 hours, within regular medical floor, within 12 hours, and we will admit them, talk to specialists, see how sick they are, and make a treatment plan. It was fun to do it.
Doctor, you know we're here about Genelina Bellissimo, correct?
Correct,
You have no independent recollection of Genelina, correct?
correct,
Your only recollection of Genelina is your review of the hospital chart, correct?
correct,
Were you able to review your prior testimonies?
correct,
Were you able to review a copy of the records before your testimony today?
correct.
Who provided you with a copy of the records?
My attorney on the defending side,
And who's that?
Dirk and their company.
You consider them your attorneys?
No, they are representing the defending physician, Dr. Wilson, and university hospitals.
Have you met with them outside your testimony, Doctor?
No,
Did they provide you the records to review?
correct,
And were you given the whole admission chart for Tri-Point for Genelina, September 25th, 2018?
yeah, in a binder.
And Doctor, could you tell us how you became involved in Genelina's case?
If I recollect whole thing, emergency room physician called me, and we accepted the admission, and then we did admission orders, pretty standard procedure.
And, who's the emergency room physician?
I forgot the name.
Stephen Lajewski?
Yeah, I know Dr. Lizeski.
Do you know Dr. Lajewski?
Yeah,
Met him many times?
we worked together many times. Strong doctor.
And, do you have any recollection, or based on your review of the records, do you know if you saw Janalena prior to September 25th, 2018?
I don't believe so.
She was not one of your patients that you saw at your office?
Yes,
She was not, correct?
correct.
And so, how does this process work? How does Dr. Lajewski contact you?
Through their secretary, through my office, or my answering service.
I'm sorry to interrupt. Does he page you, or does he call it an office, you know?
It can be both ways. They have my cell phone number, they can call me, or they call to answering service depending upon how fast they can get hold of me.
Okay. And, once you get that call, let me go back. Do you have any independent recollection of your call with Dr. Lajewski?
No.
Generally, in your custom and practice, what would be transmitted to you by Dr. Lajewski and all those times he's turned emergency room patients to you? What type of conversation would you have?
Usually, that's very focused, like patient is this old, this is the admitting diagnosis, then patient is stable, and disposition, whether patient going to ICU, regular medical floor, and whether they need specialist on the case. And if patient already have the specialist, they usually call same, or they give us a choice. That patient does not have their own specialist, whom we want to choose. Usually they have somebody on call, usually we choose that, or we have some independent arrangement, but above all, family choice comes first. Whatever family wants, we do that.
Would Dr. Lajewski over the phone typically ask you if you would admit the patient?
Yes,
Dr. Lajewski himself cannot admit the patient, correct?
correct.
And would he call you up with regard to University Hospital patients? Patients that come in that had an internist previously with the university?
That used to be the practice.
Excuse me. Hey, doctor, would you make the decision over the phone to admit the patient, or agree to admit the patient, or how would that work?
Yes, it's usually phone conversation.
Okay, upon then talking to Dr. Lajewski and making the decision or agreement to admit the patient, what would you do next as it relates to Janalena?
Well, first is we establish the severity, how severe is the patient. And depending upon that, if I recollect 2018, we could give admission order right there on the phone to nurse, like admit, consult the specialist, start this. That was pretty standard practice. But patient is pretty stable, then we usually do the rounds and put in a computer. That all depends upon how severe the patient was, but things are different now.
And, did you eventually go down and see Mrs.
Yes,
Ursula?
yes.
Doctor, I'm gonna hand you what I've marked as Plans Exhibit 1D, to copy of your history physical.
Yes, sir.
You may approve that
Yes,
during your testimony.
Yes, sir.
Is this the documentation of your examination when you got the TriPoint to see Mrs. Bellissimo?
Yes. Yes.
And doctor, what did you mark down as a chief complaint?
Very first is the near syncopal episode.
I'm sorry, could you repeat that? I'm sorry.
Syncope, or near syncope fall.
Yeah, you have a column at the top that says chief complaint. Do you see that? What did you dictate?
chest pain, bradycardia, passed out, and syncope.
Bradycardia is what?
Slow heart rate.
And Doctor, what was the Genowina was able to give you a history at the time? Correct?
Yes.
And what was the history that Genowina provided you at the time of your visit? I'm sorry, Doctor. Let's just go back. Your note is dictated at 8:57 a.m. So can you and I presume that you saw Genowina and examined her prior to 8:57 a.m. on September 25th?
Correct.
And so what history did Genowina provide to you
Well, she told us she's extremely weak and lethargic, not feeling good for the last 3-4 days. She has a shortness of breath. She has a symptom of exertion, and she went for dialysis. She felt dizzy and drowsy, so she had a slow heart rate. So she was sent to the hospital.
And Doctor, in particular in that section, you documented a little bit about your call with Dr. Logiski, correct? You write 79-year-old lady presented to the emergency room via EMS.
Yes,
Because of passing out and fall, emergency room physician discussed with me, correct?
correct.
And then as you say, it was decided to admit. What were the reasons you and Dr. Logiski tried to admit the patient?
Can you repeat, please?
As you read your note, Doctor,
Yes.
what were the reasons you dictated or documented that you and Dr. Logiski admitted that this is Alyssa?
Yes, sir.
What did you write there, Doctor? It was decided to admit for what?
Bradycardia, slow heart rate, chest pain, to rule out the myocardial infarction, which is the heart attack in simple day-to-day language. Syncope means passing out, and possible infection.
And that actually was all the information that Dr. Logiski provided to you, correct?
Correct, that's summary of that.
Okay, and then your note begins, following that was your telephone call with Dr. Logiski. I came and saw the patient in the emergency room, correct?
Correct.
Is that typical, you see the patient in the emergency room?
It depends on their location. If they've gone already upstairs to the floor, then we see them on the floor.
And doctor, at that time, then you examined the patient? Did you examine the patient?
Yes.
And what did your examination disclose, doctor? You may refer to your note.
Yes, it's a page 2.
What did your examination reveal?
Well, we have vitals on the top. Heart rate is only 45. Breathing okay, blood pressure stable. And the main thing was heart sound was and S3 possible. Third heart sound denotes usually heart failure, extent of heart failure. So that's important. Leg has edema, means fluid collection. That goes with the heart. So, no neurological deficit. So she was somewhat confused, but could answer all my questions.
Doctor, I'd like to cover the vitals if I can a little bit. You put her vital down 36.7, that's her temperature in Celsius.
Yes,
45 is her heart rate.
yes.
Well, what's the normal heart rate, doctor?
Well, for that age group, I would think about 65, 70 to 85, roughly for her.
The respirations at 17?
Yeah, that's
What's the
okay.
normal respiration rate, doctor?
That's acceptable, about 14 to 16, but that age group maybe, remember she is on dialysis patient, so they're slightly different, but 70 is acceptable.
Okay. For a normal person not on dialysis, is the respiratory normal rate 20?
Yeah, 14 to 18, for me and you, we are sitting talking, yeah.
And her blood pressure was 154 over 51.
Yeah,
You mentioned that you thought it was normal. 154, a normal systolic figure?
Once again, they are not that easy to interpret, but considering her age, dialysis, vascular issues, that's acceptable number.
And 51 was her heart rate, we already talked about that as well.
45 is the heart rate.
I'm sorry, 51.
51 is the diastolic pressure.
Diastolic,
Yeah.
Diastolic is lower than normal, correct?
That is low, but that's a wide pulse pressure. That shows her vasculopathy. That means she has, in simple English, lot of stiffening her aorta and the peripheral system. That's what a wide pulse pressure.
Doctor, then we continue with your note on page 3.
Yes, sir.
You decided to, again, to admit the patient. Did you issue any orders at this time? Do you
Yeah.
recall? What orders did you issue?
I can read it to you. I think chest pain protocol, consultants for the dialysis, Dr. Wilson for cardiology, pretty standard hospital program, hospital diabetes care. We have pretty standard good orders.
So you schedule her for dialysis, correct?
I don't schedule, I just call consultant and they schedule.
Okay. But you got the process
Rolling,
rolling to get her into the dialysis.
yes. That is expected of me as an admitting doctor to make a treatment plan.
Your note indicates, doctor, that you issued an order for infectious disease consult.
Correct?
That's number 1 on your list.
Yes, correct.
And why did you bring in an ID consult?
Like I dictated, sir, 3-4 days of history, not feeling good, patient on dialysis. Usually infection is one of the important etiology to cover. And it's a fistula infection, she is diabetic. So we started on UTI is one of the common ones. So we gave antibiotic, broad spectrum, and get infectious disease because something treatable like infection, we always want to go first, treat it, done with it, so that it does not get any worse.
And I believe the infectious disease doctor was Dr. Cox.
Yes,
Doctor, you brought in a neuro consult, correct?
yes.
Do you remember who the neuro doctor was? Neurologist?
I believe at that time there was a group, Sunshine and his partners, I think Smith and Testman, one of them.
Why did you bring in a neurology consult?
Because of the history of fall and syncope to rule out stroke.
Actually, you brought in a cardiology consult, correct?
Correct.
Why did you bring in a cardiology consult?
Because of low heart rate, cardiac arrhythmia.
And you also had an indication you wanted to make sure she didn't have a heart attack, correct?
Correct.
And who did you bring in for cardiology?
Can you repeat, please?
What doctor did you bring in for cardiology?
Dr. Thomas Wilson.
You were pretty familiar with Dr. Wilson at the time.
Correct.
Could you tell the ladies and gentlemen of the jury how many times you had worked with Dr. Wilson in the past?
Dr. Wilson and me are working since I started practice, 25 years, and not because, he's a strong cardiologist, and, he served, patients here who I think is 35 years now, and there is nothing not to choose him. He's a perfect cardiologist.
And so, would it be safe in saying that you worked with Dr. Wilson before hundreds of times?
Correct.
You brought in a nephrologist, a kidney specialist doctor?
Correct.
Dr. John?
Correct.
That was because of her dialysis?
Correct.
And doctor, what's the purpose, just so the jury understands, your role in treating Mrs. Bellissimo during this hospital stay? What was the purpose of bringing in these consults?
Good question. Medicine is very specialized now, and my role is admitting doctor, make a treatment plan, assemble all things. I'm a quarterback. When I'm admitting doctor, I'm a quarterback of the patient. So my job is to assemble all the right doctors and monitor the progress. My day one is most important when I have to make a treatment plan, get the right people, and depending upon the urgency, how urgent they are, get situated, and then follow them every day, make changes as needed, and my role becomes very important at the time of discharge, how patient discharges. So that usually flows. The pretty standard practice. It used to be that way. And patient trusted us because I was their own doctor on their payroll, so they trusted us.
Okay, and Doctor, you mentioned that medicine's very specialized. It was important for you to have Mrs. Bellissimo have all the right specialists in place to take care of any problems she might have within their area of specialty, correct?
Correct.
So Doctor, you relied upon Dr. Cox to take care of all of Mrs. Bellissimo's infectious disease needs, correct?
Correct.
You relied upon Dr. Wilson to take care of all of Mrs. Bellissimo's cardiac needs.
Correct.
And you relied upon Dr. Zahn to take care of her needs for nephrology.
Correct.
And, you relied upon the neurologist to take care of, whose name escapes me right now, but you relied on the neurologist to take care of all of, Mrs. Bellissimo's neurological.
Correct. It's a teamwork. Basically, it's a teamwork.
But Doctor, those physicians had the right to issue orders for Mrs. Bellissimo?
Correct.
They had the right to transfer her from any portion of the hospital, from a regular floor to an intensive care unit, correct?
Correct.
And they had the authority of transferring the patient to a different facility if need be.
Correct.
And you relied upon them to take care of those areas of specialty, correct, Doctor?
Yes.
And in particular, you relied upon, as you have so many times in the past, Dr. Wilson to take care of Generalina Bellissimo's cardiac needs.
Correct.
And you would expect, Doctor, if there was a cardiac problem, or an infectious disease problem, or a neurology problem involving Generalina Bellissimo during this hospitalization, you would have expected those nurses to reach out to those specialists.
Correct.
Okay, Doctor, and under plan, what did you write on page 3 of your history and physical?
That's basically a summary of everything. That neurologic, cardiology, infectious disease, nephrology consult. The patient will be admitted to step-down unit as inpatient care. It's basically for insurance companies. They read what the plan is, and length of stay 3 to 4 days, approximate to the best of my ability. When I'm seeing the patient at that point, so they can plan for the bed and stuff. They can go back and forth depending on patient's needs. It's a pretty standard procedure.
Doctor, you electronically signed the note on the 26th of September 2018, 16:29, 4:29 p.m., correct?
Correct.
And you see that 4-04.00, that means you're on the system for 4 minutes, correct?
Correct.
And when you electronically signed, Doctor, it means you weren't present at the hospital, you did that remotely, correct?
It can be both ways.
Doctor, do you remember in 2018 that you could access the medical record and electronically sign your notes on your phone?
No, I don't think phone we could do at that time.
You could do that now?
Yeah,
You could do it on your laptop?
we could do on laptop, yes.
You sure
At that,
about that?
I believe we could reach Sorian. It was Sorian was the name of the system at that point. I believe we could reach Sorian through our office at that time, but not on phone or on the computer. Now we can do it.
Okay, so Doctor, you then, on your office hours, I think you would go to your office once you left the hospital.
Correct.
And, did you ever again see Generalina Bellissimo?
I believe I didn't.
Do you remember the office record ever reflecting the fact that you saw Generalina?
No, I think I answered that question. I don't remember I saw her before.
Did you see anywhere in the hospital record where it reflected that you were back at the hospital and saw her?
I don't believe.
When you had that you admitted in the hospital, as far as going to see that patient?
Usually we are required by hospital rules to see them once 24 hours, but when patients are sick, many times we go evening back again. That's my routine. Evening I used to go to hospital almost every day, and especially when they are sick, or usually it will be a family meeting or a new admission, and we will see them again.
Generally, has remained at Tri Point, for the 3 to 4 days you mentioned that was anticipated. When would be the next time you would have seen her?
Usually depend upon her severity, either morning or evening. More severe patient gets seen very first thing in the morning, more stable patient gets seen later in afternoon or evening.
At least once every 24 hours, so if you didn't go back that day, you would have gone back the following morning to see Generalina?
Yeah, that's correct.
After you recall, you review the notes, seeing that you got a phone call later in the day concerning Generalina,
Okay.
do you remember seeing that in the notes, Doctor, the nursing notes, when you reviewed the records?
Nursing notes. I can review with you right now.
I'm sorry, Doctor.
I can review them because nursing notes is a different section. They don't flow with the doctor's note at that time, but I can look at it.
Actually, based on your review of the file before coming here today, you don't recall if you received a call concerning Generalina later that day? No?
Means specific to what? Because we get many calls throughout the day about patient condition. So if you can elaborate, refresh my memory, so I can really focus more, I would appreciate that.
Hey, Doc, I'm gonna hand you with his mark, this place exhibit 1A.
Thank you, sir.
And it's a portion of the,
Nursing
nursing.
home.
Can everybody see this, or I need to move this up? Move it. Doctor, if we look at the entry,
I remember it.
I'm sorry, Doctor, I gave you the wrong exhibit.
I remember seeing this.
Hang on, Doctor. Doctor, here you go. I'm sorry, I gave you the wrong exhibit. Here's one.
Thank you, sir.
1A?
Yes.
All right.
And Doctor, you recognize those as nursing home notes from the hospital?
Yes, sir.
And Doctor, if you look down at the entry, the bottom, for 9/25/18 at 17:45, it's 5:45 PM. You see that?
Are you on page 1?
Yes. Now, let me see your exhibit 1A. So, I made the copies. Yeah, this is the wrong exhibit, I'm sorry. So now the copies got included on.
Are you on page, you can follow easily on the bottom. Is it page
All right.
3?
Page stamp page
Hold on.
3?
213.
Hold on a minute. Let me, hold on. Let me see that, please. All right, so what on 1A are you referring the doctor to specifically? What page?
The, bottom entry, Your Honor.
On page 1?
Page, yes, 9/25/18 at 17:45.
Okay. Go ahead.
Doctor, does it indicate that you got a call at that time? see that note, doctor, still no call back from Dr. Wilson. Dr. Lee was notified.
Let's let him, hold on, let's let him answer that he didn't answer that question that you asked.
Very on top, right? We are following from 1742.
Down here on the bottom. Your Honor, where's that other exhibit? He's got the old exhibit.
He handed me and I handed it right back to him.
Yeah, I'm sorry, somehow the exhibits got copied.
Here. You just give me a moment.
I'm gonna use the, blow up that, to save some time.
Yeah, I can read.
You see the answer here I've highlighted in 9:25:18 at 5:45 a.m.? Here's his note at page 212 on the page.
Yeah, I remember reviewing it.
It says, no callback from Dr. Wilson. Dr. Lee was notified of changes in new orders. Correct?
Correct.
So they called you at 5:45, correct?
Correct.
We can assume you did not go to the hospital then in the afternoon, correct? You were here
Correct.
at 5:45.
But what day of the week was that? Can I consult my phone to see what day of the week was that? Because my schedule changes every day of the week. Most likely I was not in the hospital.
This was a Tuesday, Doctor.
Okay, then definitely I was not in the hospital by that time.
And do you know what new orders that you issued?
I can review them, most likely probably increase the intensity of the treatment.
Do you remember this call at all, Doctor?
No, I don't.
Do you remember what the hospital nurses told you?
No, I don't recall details.
You did a review of the medical records in any way refresh your recollection as to what the nurses told you at that time?
If you allow me to read my orders, I will.
Okay. Doctor, I have what's marked as, one is exhibit K, Your Honor, I have a copy for you, it's not on my original list. Here you go.
Do they have a copy of it?
You can give it.
Did you say
K,
K?
it's based on page 65.
1K, okay, 1K.
Does that reflect orders that you gave at that time, Doctor?
Correct.
What orders did you issue at that time?
It was the order which you highlighted with the yellow highlighter. It shows that troponin stat,
What time did you order that, Doctor?
5:47, the afternoon, 17:47.
2 minutes after the call, correct?
Yes.
Did you order anything else, Doctor?
Yeah,
Okay.
right on the top there is an order,
Tell us what you ordered at the time.
basic metabolic panel.
It's a blood test?
Yes, sir. And I also ordered blood gas. Blood gas, I think. No, that was ordered.
Okay.
Yeah. That was ordered same time, right on the top.
All ordered at 21:47, correct?
No, sir. So, I think it is ordered on the 5:57, 5:47, 5:47.
Doctor, did you also order pain medication? Norco?
That was ordered, sir, I think it looks like at verbal order at the 25th of September at 3:53.
Okay, and what about below it, Doctor? It says your name and Norco was ordered at 21:47. 5:47. You see that?
Yeah.
Say yes?
I beg your pardon, I'd like to clarify the timings, because you see that it says that, it says that 25th of September, 9:47, and about that 15:53, which is 3:53, just before 4 o'clock.
Okay, so Norco was ordered later.
Yeah,
So it 1747, you ordered a blood gas, metabolic panel.
Yes.
And troponin.
Yes.
Anything else?
No, that,
And doctor, does that refresh your recollection in any, as to what the call was about the nurses made to you at that time?
probably as clear.
Hold on a minute. The question is whether that refreshes your recollection about your conversation with the nurses. So if you recall that, fine. If you don't recall that, you can't speculate as to what they told you.
Thank you for
Does
the,
that refresh your recollection?
I can't recollect exact details, but I can probably go back in the way, how the normal routine happens and what I did.
Okay, based upon what you did under the normal routine, what do you think happened with the nurses?
It appears, first of all, this nurse, John Levente, is a very respected nurse and with good reputation. So patient condition probably getting worse. So he called me, because patient is complex, so these tests are done, troponin to make sure she does not have a new heart getting in the middle of the heart attack, basic metabolic panel to see whether her kidney function getting worse or electrolytes, especially potassium going up and down, we need to know right away, and blood gases, so that we can manage appropriately. And I believe all these tests were done stat, so we are in a crisis situation to help the patient.
I was gonna get to the stat, doctor, but first off, whatever, based upon what the nurses told you, you ordered a troponin to make sure she wasn't having a heart attack, correct?
Correct.
And the word stat, what does that mean on the order, doctor?
You have to do test right there, drop what you're doing, do this first.
Because there was an urgency in that order for the troponin to make sure she didn't have a heart attack.
Correct.
Doctor, you recall getting any more calls from the hospital that evening? One more call, do you recall that at all?
I'm afraid I'm not, but I'm willing to review again with you.
Doctor, there's a note, and I'll show you in a moment, 9/25/18 at 7:29 PM. It says Dr. Lilly.
What exhibit are you on?
1A, doctor, I'll have to get your copy somehow.
All right, go ahead.
7:29, Dr. Lilly notified of an elevated troponin of .41.
Yes, yes,
You see that, doctor?
yes, sir.
So the hospital called you back to notify you of the results of the troponin, correct?
Correct.
Is that basically a courtesy call?
No, this is more than that,
Okay, what is it, why is it more than that?
because it is more than normal limit. So they have to inform the doctor, admitting doctor, this is concerns as a change in patient condition. So relative to her last troponin, if it is showing higher, then there is a good chance patient is in the middle of a heart attack.
If that's concerning that she might have an acute myocardial infarction
Correct,
because of that raised troponin, correct, doctor?
correct.
And you knew, as we covered in the previous footnote, they were reaching out to Dr. Wilson in the hospital, correct?
After reading this chart, yes, it appears that way.
That's correct, after reviewing the chart. And you relied upon Dr. Wilson to handle that situation, correct?
Objection.
Correct.
Hold on. It's overruled, go ahead.
And that was your normal arrangement with Dr. Wilson and had been for the past 35 years.
Dr. Wilson and his group, his partners.
Thank you, I have no further questions at this time.
Cross-examination.
Hi, Dr. Lilly.
Hi.
you put, page TP 64 up here?
Which exhibit? Which exhibit? Which exhibit? You gotta tell them. Here.
That's exhibit B1, TP 64. If you could blow up, bottom order that, actually it's 65, I'm sorry. And, if you could go to the order that, was previously discussed, halfway down, the Norco order. Well, hey, John, can you pull this up just so we're on the same page? Okay, so this is ordered, entered by, date, time. Just so we're clear here, this order for Norco was ordered by you here at 1553?
Probably, yes.
Well, I want to make sure we're on the same page here. Ordered, Dr. Lele, entered by John LeBounty, date 9/25, time 1553.
Yes,
Okay, so that order, just so we're clear, for Norco, FAMED was ordered at 3:53.
yes,
Okay. The other orders were, for the blood gases, metabolic panel, and its components, those were ordered at, and I'm sure you can't see that far, but it says 1747 that we talked about before, right here.
Is that correct, Doctor?
yes,
All right.
correct.
Now, Doctor, when, this patient presented on September 25th of 2018, you were the admitting doctor,
Yes,
and you had mentioned your training. You had, trained as an internist, back in India, and then you went to UK, you indicated, then you came to the States in '96, and you did a residency in internal medicine at Fairview General Hospital.
yes,
And that residency would have been from 1996 through 1999.
correct.
And just so we're clear here, the practice of internal medicine, in a nutshell, how would you describe that?
Well, at that time, I did office, hospital, nursing home, every day,
Right, but you take care of patients from head to toe.
correct,
You're like the patient's primary care doc.
correct.
So you have specialty in many areas of a patient's physiology, anatomy, et cetera. Is that true?
Not specialist, but I'm generalist.
But you've trained in cardiology, pulmonology, nephrology.
Yes,
And doctors that have internal medicine training, some go on to have fellowships.
yes,
So a nephrologist would have internal medicine training, then they do extra training in.
3 years, yes,
A pulmonologist would have an internal medicine residency or 3 or 4 years, and then they go in to have a fellowship in
3
lung
years,
disease. Cardiologist, internal medicine, then extra training in heart.
correct,
Infectious disease, internal medicine, and then an extra, some training in the infectious disease.
correct,
And you mentioned when you saw this patient, you had consults, you went to Dr. Cox as the infectious disease consult because of issues regarding, infectious disease.
correct,
And, Dr. Kendis, I think, was the neurology consult.
correct,
And then Dr. Wilson, cardiology, and you got Dr. Cox, Dr. Ism, and nephrology.
Correct.
And you were working together as a team.
Correct.
When, let's just go to page two, exhibit B, page 212. This was the nursing note that plaintiff's counsel discussed with you. Incidentally, John, 212? Yeah, big number, TP 212. Sorry, didn't hear me. And doctor, incidentally, when this patient was admitted, you mentioned that you thought the stay was gonna be, you estimate 3 to 4 days, yes?
Correct.
And you're gonna continue to follow the patient.
Correct.
Each of these consults that you had requested, that includes Dr. Cox, Dr. Asa, Dr. Kendis, these consults could have transferred this patient at any time, true?
Correct.
And you as the admitting doctor, as a quarterback of that team, if you felt this patient needed to be transferred, that was in your power as well.
Correct.
Okay, so if we could go back down to 17, let's just cut off, Chad, if you could just blow this part up so we can see it. Well, all the way down, from the halfway down to the top. There we go. Little bit, you have one more down there, 2 more. Okay. All right, so you were contacted at 5:45.
Correct.
You indicated those orders, and we talked about those orders before.
Correct.
Those would be consistent orders for a patient that had just gone into AFib.
Correct.
And looks like Dr. Azam was updated regarding these acute changes and
Correct.
agreed with the treatment.
Correct.
Dr. Urban is who?
Hospitalist.
A hospitalist?
You can call them house doctor.
Okay, so explain to the jury what a hospitalist is.
Uh,
Over at Tri-Point back in September of 2018.
Hospitalist is a new breed of doctors. They came in existence few years ago and now they have taken over everything. Basically, they stay in the hospital. They are there 12-hour, 10-hour shift, and they take care of patients like they replace old internists. They are by training internists or family doctors. They stay there. They have no office. They do their shift 8 hours, 12 hours. No patient belongs to them like ER doctor. Like many doctors don't go to hospital. Their patient, they admit and discharge. So they are Johnny on spot. They are there all the time. And they had a second role, which they are contracted by the hospital to provide house officer duty. And what happens that they go, for example, so my patient with specialist, but if needs, then like Dr. Cunningham wrote there, their duty, they're asked, hey, patient is getting sick, Mr. Lele, Dr. Lele is in office, he cannot come. So come and see the patient. And because they are in the building, it is their duty. I mean, they are contracted for it.
Doctor, just my question more focused on, their training would be?
Hospital medicine.
Right, internal medicine as well?
Most of the time, yes, they are internist.
And then, so we got Dr. Azam contacted, Dr. Urban contacted, and then Dr. Cunningham at 1825 had called back. And then you were contacted thereafter regarding the troponin. That's the last time you had any interaction, on the 25th of September?
Probably.
Dr. Cunningham is a cardiologist.
Yes.
patient had, gone through dialysis. From approximately 1:15 to, this is page Exhibit B, 245. Looks like your dialysis ended at about 16:15. And dialysis is utilized in patients who have end-stage renal failure.
Correct.
And you're aware of that history when, you saw Ms.
Objection, Your Honor. Foundation.
Correct.
Overruled.
Just so we're clear here, the dialysis is basically clears the blood of toxins.
Yeah, in layman language.
Same objection, Your Honor. Overruled.
Doctor, going back to the nursing note here, after you were called with the troponin level, you saw that Dr. Cunningham had followed up with the patient.
Correct.
And that Dr. Cunningham is a cardiologist, interventional cardiologist.
Correct.
I don't have any other questions, thank you.
All right, any redirect?
Yes, Your Honor.
Dr. Louis, how would you know what Dr. Cunningham did when your last contact with the hospital was at? When they notified you of the troponin, your last contact with the hospital was, it's 7:36. You didn't have these hospital notes with you, correct?
Correct.
It doesn't indicate that the nurses told you that Dr. Cunningham was involved, does it?
No.
Then how would you know that if Dr. Cunningham was involved or not?
I didn't say I know.
You assumed that cardiology was handling it.
Correct. And Dr. Cunningham normally used to cover Dr. Wilson all the time.
Okay. And one more question, Doctor. You had mentioned that hospitalists are taking over.
Yeah.
Hospitalists are they fulfilling your role at these hospitals that you used to have when you admitted patients through the emergency room?
Correct.
And that's why you don't have the hospital practice today that you had in 2018?
Well, let's put it this way, this is a system decision, not mine.
But that's why you're not at the hospital anymore as much, because the hospitals have taken over.
It's a political question. I don't have to answer it. This is the university hospital's policy decision. I'm an employed physician. I have to follow their rules.
Okay, I understand. But now it's the hospitals that are putting all the consults together and ordering patients for the emergency.
Correct.
Right?
Correct. Yes, that's the state of
Like you
affairs.
did for Generalina.
Yes.
No further questions.
Any recross
Yes, Your Honor. John, page 212.
of exhibit what, B,
Exhibit B, I'm sorry. And this was,
B1?
yeah, and John, if you could just pull up these two. Doctor, this was an exhibit that plaintiff's counsel just put up with you, 1A, I believe it was listed.
Yes, sir.
All right, and you had been notified of the troponin at .41, and that nursing note indicates that Dr. Cunningham was notified at 7:36. So it's .41.
So Dr. Cunningham was notified after me.
Right.
That's all.
That's noted on the exhibit that Mr. Blanken had in front of you.
Right.
And the patient was not having active chest pain at that time.
Correct.
All right. Nothing further.
All right, you may step down, doctor, thank you.
Thank
Thank you. All right, ladies and gentlemen, the next witness is gonna be brought to you by video, and that's, Dr. Cunningham, correct, Mr. Lyken?
Correct, Your Honor.
All right.
No, Dr. Alexander.
I'm sorry, Dr. Alexander. And it's gonna be by video, and when you watch the video, you are to treat that testimony the same as if you were sitting here. You understand that? Okay? That, I anticipate that's gonna take about an hour, 50 minutes or thereabouts, hour 45, hour 50 minutes. So we're gonna take a 15-minute break right now. When we come back, then we'll have that testimony. Do not discuss the case among yourselves or with anybody else. Don't try to find out any information from any other source, and do not come to any conclusions until the case is submitted to you. So we'll see you in 15 minutes. Okay, anything else, put on the
Your Honor,
record?
just real quick, and I apologize to the court, somehow my wrong exhibit was copied as 1A. I have a copy here, could I ask that the clerk can make some copies for me so I can get it to the court and counsel exhibit 1A?
Yeah.
Thank you.
Anything else?
Good morning. This is the beginning of the video one
Recording in progress.
of the deposition of Jonathan Alexander, MD, in the matter of John Bellissimo et al. Versus Tri Point Medical Center et al. Today date February 20, 2023. The time on the clock is 10:12. My name is Gil Perez, I'm the videographer. The court order is Luis Botrel. We are here with USB Global Litigation. Counsel, please identify yourself after which the court order will swear in the witness.
I am the plaintiff's counsel. My name is Jeffrey Lightman, and I represent Melissa Wilson.
And Dirk Schneider, on behalf of Dr. Wilson, Dr. Thomas Wilson, and Mr. Sue.
Doctor, I'm going to ask you to raise your right hand, please. Do you solemnly swear that the testimony you're now about to give to be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you, Doctor.
Doctor, for the record, could you give us your full name for the jury?
Jonathan Alexander.
And Dr. Alexander, you understand we're here for trial testimony and you will be appearing in court next month.
Yes.
Doctor, what is your current home address?
18 Dock Road, Norwalk, Connecticut, 06854.
And what is your current profession?
I'm a cardiologist.
Doctor, why don't you tell the ladies and gentlemen of the jury, if you will, what is a cardiologist and what does a cardiologist do?
A cardiology, the field of cardiology is a subspecialty of internal medicine, and it requires additional training after training to be an internist. Cardiologist specializes in taking care of patients with cardiovascular disorders, which there's many, and solely practices cardiology to that end.
And, Doctor, you mentioned training, let's discuss if we can and introduce the jury to your educational background. Could you let us know where you went on your graduate school and then into medical school and where you received your medical training?
I went to Harvard College. I then went to the Albert Einstein College of Medicine, 4-year program. I then did my training at Yale New Haven Hospital, the Yale University School of Medicine, 3 years of internship and residency, and then 2 years of fellowship.
Okay, so Doctor, I have a copy of your CV with me, and it indicates that you graduated from Harvard in 1968.
Correct.
Went on to medical school the following year at Albert Einstein.
No, I went to Einstein. I graduated class of 73, so I entered in 69.
Right, okay. And your internship in internal medicine, Doctor, what is an internship you completed at Yale?
It's a 1 year of training. It's no longer called an internship. It's actually a first year residency. It's a program of taking care of hospitalized patients. You're also in the clinic as an outpatient, but most of it's hospitalized patients under the supervision of an attending physician, and you're caring for patients on an internal medicine ward.
Okay, you mentioned your fellowship, Doctor. What was your fellowship?
It's cardiology or cardiovascular disease.
I guess what is a fellowship?
It's advanced training after you've finished internal medicine, concentrating totally on the care of patients with cardiovascular disease.
And just so, and make sure everybody understands, cardiovascular diseases are diseases of the heart.
The heart and the vasculature.
Doctor, you're currently licensed to practice medicine.
Yes, I am.
And is your medical license in good standing?
Yes, it is.
In what state are you licensed in?
Connecticut.
And Doctor, according to your CV, you were first licensed in 1974?
Correct.
How old are you today, Doctor?
75.
And Doctor, You have, board certifications as well?
Yes.
Could you explain those to the jury and what the board certification is?
It's a certification from a body that says you've met the qualifications to be an internist, and I'm board certified in internal medicine. There's a board, a subspecialty board under that umbrella, which does cardiovascular diseases, and they certify based upon training, examinations, that you are certified to be a cardiologist.
Okay, and Dr. McDevitt, according to your CV, you were board certified in internal medicine in 1976, and in the subspecialty of cardiovascular diseases in 1979.
That's correct.
Doctor, you currently have teaching responsibilities?
Yes, I do.
Could you explain those to the jury as you said those teaching responsibilities are today?
I teach at Danbury Hospital, which is a subdivision of the New Vampton healthcare system. I teach medical house staff, interns and residents, and I teach cardiology fellows. I also teach house staff who rotate from the University of Vermont Medical School, and house staff who rotate at the hospital from Yale School of Medicine.
Okay. And previously, Doctor, you had some teaching responsibilities over at Yale, is that correct?
Correct.
What were those, Doctor, previously?
Previously, they were supervising fellows in the cardiac catheterization laboratory, supervising fellows on the cardiology ward, being responsible for teaching of the interns and residents, both in the emergency department and on the ward.
Okay, and it looks like those teaching responsibilities ended somewhere in the 90s.
Correct. I continue to teach the house staff and fellows when they rotate through Danbury Hospital.
Okay. All right, Doctor, and what is your current practice? Your clinical practice, I'm sorry.
I see patients from 8 o'clock in the morning till 5 o'clock at night at a satellite office in Ridgefield, Connecticut. I also see patients at the main campus at Danbury Hospital, 8 in the morning till 5 o'clock. I rotate through the hospital as an attending physician, seeing patients who get admitted with various cardiovascular disorders. That involves going to the emergency department, involves interacting with the hospitals, interacting with the ER staff, and predominantly interacting with the fellows. I also interact with my colleagues, other cardiologists as well.
Doctor, I think you had mentioned, or actually it's reflecting your CV, you previously had duties in relative cardiac labs, is that correct?
Yes.
Could you explain that to the jury?
So I had advanced training in cardiac catheterization, and from 1978 until the mid-90s, I did cardiac catheterizations on a regular basis.
Any other catheterizations include, I'm sorry?
There was a long period of time where I implanted pacemakers. There was a time that I performed cardioversions, and that's pretty much the extent of it. And there are different types of catheterization procedures. There's right heart cardiac catheterizations, which I did. There are things called pericardiocentesis, aspirating pericardial fluid, which I did as well.
Okay. And did you have duties relative to administration in the cath labs in your practice?
No.
Okay. All right, and Doctor, why did you give up those duties or those functions as a cardiologist?
If you want the honest opinion, my wife basically said it's either the cath lab or me, because it involves being at the hospital late at night, early in the morning, 7 days a week.
And your main hospital is Danbury, Doctor?
Correct.
Doctor, do you belong to any professional organizations in your field?
Yes, I do.
And could you give the jury a little idea what organization you currently belong to?
The American College of Cardiology, the American Heart Association, the American College of Nuclear Cardiology.
And Doctor, I mentioned here in your CV, you're a fellow in the American Cardiology.
Correct.
You're a fellow of the American Heart Association Council on Clinical Cardiology.
Well, I'm a fellow of the American Heart Association, but I'm also a fellow within the Clinical Council.
You're a fellow of the American College of Physicians
Yes.
and a fellow of the American College of Chest Physicians, correct?
No longer.
No longer? Have you published within your field, Doctor?
Yes.
And, Doctor, I guess I'll mark under this deposition, a copy of your CV as Exhibit A. But it's represented on here, there's 22 clinical research projects that you participated in.
That's correct.
Why don't you tell the jury a little bit about what those research projects consisted of?
There are a variety of research projects. The original ones are usually done in conjunction with the fellows at the hospital, where we make an observation about a certain entity, research it further, usually acquire patient records. I'm currently working on one regarding the cardiovascular implications of COVID, long-term COVID, issues regarding interesting cases in the nuclear cardiology laboratory that we expand upon. I have been involved in large clinical trials of new medications, new procedures, where patients are randomized to whether that procedure, medicine, or placebo. So a variety of clinical projects, none of which involve, a specific laboratory per se.
Okay, your CV also indicates, Doctor, you've contributed 31 publications to the profession.
Yes.
And in addition, 25 abstracts, and you've also contributed to books.
Yes.
In different chapters and textbooks, correct?
Correct.
Those would be all within, in some way, touching upon the field of cardiology.
Correct.
Doctor, you devote over 75% of your professional time in active clinical practice and teaching at an accredited facility of your specialty, that being cardiology.
Yes, I do.
And again, Doctor, your medical license is currently active and in good standing.
Correct.
Okay, Doctor, we're going to be going through a number of issues, a number of scenarios or facts during the course of your testimony. But at the end, I'll be asking certain expert opinions with regard to this case. Can you and I agree that in keeping with the legal standards in the state of Ohio, that all your opinions will be rendered within a reasonable degree of medical probability and research?
Yes.
And you can agree with that, Doctor?
Yes.
Doctor, there came a time when I asked you to review some medical records regarding General Bellissimo, is that correct?
Yes.
Could you tell the ladies and gentlemen of the jury what hospital records you had reviewed in preparation for your testimony here today?
I reviewed Mrs. Bellissimo's prior outpatient medical records. I reviewed the hospitalization records from her hospitalization at Tri-Point, and I reviewed her hospital records from University Hospital, the institution to which she was transferred. I reviewed the testing that she had done while at Tri-Point, including laboratory data and electrocardiograms. I reviewed numerous depositions.
Okay, we'll get to the depositions. Just, I want to make sure the jury understands what records you reviewed. So the records from Tri-Point, the outpatient records, would those be the outpatient records for Ms. Bellissimo's treating cardiologist, Dr. Wilson?
Correct.
The Tri-Point records that you reviewed, Doctor, would those be the records for her emergency visit and subsequent admission on September 25th, 2018?
Correct.
In the UH hospital records you review, would those be the records reflecting her transfer that day from Tri Point Hospital to University Hospice until the time of her death on September 27th?
Yes.
Doctor, you mentioned you reviewed depositions. What depositions have you reviewed?
I reviewed depositions from Dr. Cunningham, Dr. Wilson, the two expert witnesses from the defense.
Dr. Dowler and Dr. Messer?
Correct. And I reviewed the 4 depositions from the Bellissimo family members. I reviewed the depositions from Ms. Snyder.
Betsy Snyder?
Yes.
Doctor, you also seen the telemed call records that were provided from Dr. Wilson's office's answers.
Yes.
Can we go off the record?
Recording
No,
stopped.
we are going off the record, the time now is 10:28. We are back on the record, and the time now is 10:32.
So doctor, what did I ask you to do in this case?
You asked me to review the medical records, the depositions, and the call records from telemed.
And what did those records reveal? What I think to give the jury a little bit of background, doctor, what was the course for Mrs. Bellissimo as she entered the emergency room in September 2018?
I'm just going to refer to my timeline. She went for her usual dialysis the morning of Tuesday, September 28, 2018, and fell walking into dialysis. She was seen appropriately and transferred to the Tri-Point Hospital ER for evaluation. The question is, did she slip? Was it a mechanical fall, or did something cardiac happen to precipitate the fall? So she was evaluated there by an ER provider, and the decision was made to admit her to the hospital, which was done later, actually it's not 8:55 a.m. for cardiac evaluation and observation. She was admitted to a step-down unit. She was subsequently seen at 10:33, or the notice dictated by Dr. Wilson. She had an EKG done, and one of her medications was held, and she was admitted for observation. She subsequently went to dialysis a little later than planned, completed the uneventful dialysis in the mid to late afternoon, and at approximately 5 o'clock in the evening, she developed an abnormal heart rhythm called atrial fibrillation, and her heart rate went up to 140 beats a minute.
Okay, if I could stop you there.
Sure.
Go back a little bit, just to give the jury a little bit of background. You had mentioned you reviewed Dr. Wilson's outpatient records as well as the patient's records at Tri-Point. What was her pre-hospital condition before she got to the emergency?
She had several ongoing medical problems, one of which was coronary artery disease. She had undergone a coronary artery bypass graft surgery. In the 90s, she had a heart muscle problem, cardiomyopathy, as a result of that coronary artery disease. She was on hemodialysis for chronic renal failure. She also had hardening of the carotid arteries and had carotid stenosis. She had hyperlipidemia, history of hypertension, and type 2 diabetes.
Okay. Anything else? Did she have some kidney issues?
Yeah, she had chronic kidney failure and was on dialysis.
All right, that's true, you mentioned. And doctor, when she was seen in the emergency room, there was a decision made to admit the patient.
Correct.
Why was that decision made?
When patients fall and they have a history of cardiac disease, it's important to exclude a cardiac basis for that fall. Either a very slow heart rate, very rapid heart rate, maybe an atypical presentation for a heart attack. There are a variety of cardiac disorders that can precipitate a fall. So she was admitted for observation, testing being seen by other consultants to determine if there are contributing factors to the fall, or did she simply trip on her way into the dialysis unit?
Doctor, I take it, in your opinion, you agree with the fact that she was admitted to Five Point?
Yes.
And Doctor, you mentioned that Dr. Wilson had seen her at 10:30 a.m. What did Dr. Wilson do for Ms. Bellissimo at or around 10:30 a.m., if anything?
He agreed with the admission, he agreed with observation, he interpreted an EKG, and the metoprolol, a medication that she had been on, was held.
Okay, what's metoprolol?
It's what's called a beta blocker, it blocks beta receptors, and in her situation, she was on it for hypertension, and it can cause a slowing of the heart rhythm, and because of her heart rhythm disturbance upon presentation, and the history of falling, it was felt that holding it would be appropriate.
Okay. And, Dr. Wilson, at that time, took a history from Ms. Bellissimo?
Yes.
Do you feel this history is appropriate?
Yes.
Dr. Wilson, at that time, did an examination of Mrs. Wilson?
Yes.
Based upon your review of the record, is that appropriate?
Yes.
And, we talked about, you felt the admission by emergency room doctor was appropriate as well?
Correct.
All right, Doctor, was that the last time Dr. Wilson saw Mrs. Bellissimo? Was it, sometime around 10:33 a.m. on September the 25th?
Yes.
You mentioned, Doctor, that it was about, did you say 5 p.m.?
Yes.
She had a change in condition.
Yes.
Can you tell the ladies and gentlemen of the jury what happened at 5 p.m.?
Her heart rate went from approximately 45 beats a minute to 140 beats a minute, and was irregular. It's a condition that we frequently encounter. It's called atrial fibrillation. In her case, it was very rapid.
And Doctor, I take it over your 40 years plus in practice as a cardiologist, you've treated people similar to Ms. Bellissimo that come into the emergency room, you've seen people similar to Mrs. Bellissimo that come into the emergency room?
Thousands of times.
And you've treated people with AFib?
Thousands of times.
And you've interpreted EKGs?
I do it on a regular basis.
What's the proper, is it an EKG or ECG? I see it both ways.
Electrocardiogram it's either German electrocardiogram or it's been anglicized, the ECG.
Okay, so.
Either one is correct.
Okay, I'm used to the EKG, so I'm going to go with EKG. And Doctor, the EKG, the first one I believe was taken at 6:10 in the morning. How was that EKG? I think I had it there.
Yes.
Here you go. You want to see it there? I'm fine.
Actually, this is from,
Just the top page.
yeah, so September 25th, at 6:10 in the morning, it shows a junctional bradycardia, and the heart rate is 36 beats per minute.
Okay. I'm gonna, you can. Maybe you could hold that up at the jury, Doctor, on this board. The camera can zoom in on it, and you can show the jury what you're talking about there. Be mindful of that computer. Now, we're holding up to our camera.
Okay. So, you see these spikes here, that's part of the QRS complex, and we determine the rate by looking at the distance between each of these beats. And this is an abnormally slow heart rhythm. So it's one beat here, several seconds, another beat here, several seconds, another beat here. So what stands out is the slowness of the heart rhythm.
Okay, and that's the reason why she was shaken off the mat.
Correct.
Thank you. Did she have another EKG doctor at or around 5 o'clock?
Yes.
Wait a minute, doctor, there's some papers here. Yeah, I'm gonna give you the EKG doctor, it's dated September 25th at 5:12 PM. Is that the EKG you're referencing?
Yes.
Could you show the ladies and gentlemen of the jury the change in the EKG?
I think what stands out,
Can you see it okay?
oh, I'm sorry. What stands out is the heart rate going up dramatically from 36 beats a minute to what is being interpreted as 131 beats a minute. There are times it's even faster than that. And there are certain changes in the configuration of the QRS complex that are concerning.
Okay, are those called ST elevations?
Yes.
And what is an ST elevation?
When one injures the myocardium, the EKG reflection, the electrical reflection is ST segment elevation.
Can you point one out to the jury?
Sure. Right here, in this lead, and right here, in this lead.
Do you have that? All right, thank you, doctor. So, doctor, as a result of that EKG, what was going on at Southside? What was the nurses doing? What was happening?
They were concerned by the changes in the EKG, and they reached out to Dr. Wilson for his input.
Okay. And that was the nursing notes for Ms. Bellissimo that go from September 25th, 9:25 a.m. all the way to September 25th at 2000, which is 8 o'clock.
Correct.
And have this right there. At what time did the nurses page, first page Dr. Wilson?
5:05 p.m. Actually, they say about paged at about 5:10 to call back stat.
Okay, what's that mean, Doctor?
Stat is a term derived from the Latin, which means immediately.
And what was the reason why the nurses asked that Dr. Wilson page?
Because her electrocardiogram was acutely unstable.
And Doctor, I've highlighted the sensors on the records that you have, and you could hold it up for the videographer. Did Dr. Wilson call back as a result of that page at 5:10?
No, he didn't.
Was Dr. Wilson paged again?
Yes, he was.
And what time was the second page?
5:30, it was repaged.
And why was he repaged by the nursing staff?
Because they needed direction for Mrs. Bellissimo's care.
Okay, could you hold it up to Dr. Wilson to see the numbers?
Sure. Dr. Wilson repaged.
You see that? And Dr. Wilson, maybe I asked you, did he call back as a result of that second page?
No.
Was Dr. Wilson paged by the nursing staff again?
There was a notation at 5:42, second page placed to Dr. Wilson.
Did Dr. Wilson call back as a result of that?
No, he didn't.
And again, in the meantime, was the patient transferred into the internal care unit?
The patient was transferred to the ICU, intensive care unit.
Why was it important, first off, doctor, with a change in patient's condition like that, is the nursing staff at the hospital required to page Dr. Wilson?
Yes.
Why is that?
they needed direction in terms of how to treat her.
And why?
Because this rapid heart rhythm is potentially injurious to her health, her heart, and her survival.
It was Dr. Wilson Page and any other type doctor after, according to those nurses, after 542.
There was a discussion with Dr. Azim, who is the nephrologist, kidney specialist, about the changes in the EKG and the inability to contact cardiology. He agreed with the treatment thus far and stated that he would call cardiology as well.
So we have now two different nurses contacting the paging services and Dr. Azam as reflected on those nursing records, correct?
That's correct.
Now, Doctor, I'm going to hand you the call record from Telemed. And again, I've highlighted it as well. And I want to discuss that. You're familiar with that record, correct?
Yes.
And I know you want to put on a little scope there.
Yeah, it's rather small, and I have a magnifying function on my cell phone.
Okay. All right, according to the Telemed call record, Doctor, when was the first page out concerning Mrs. Bellissimo to Dr. Wilson?
Yeah, 525, and it was a stat page.
And when was the second call out, or page out to Dr. Wilson?
545.
Okay, I'm sorry, the 525 was from a nurse, John, can you read that last name?
John LeBeau, N.I.
Okay, and the second page at 545 was put out by nurse, just says Megan?
Yes.
And the third call on this log, what time is that at, the first page, next page?
It was Megan Wyland, W-Y-L-A-N-D, and the first was John LaBounty. The third page was sent out at call.
Okay. And what was the priority on Dr. Azim's?
It was a stat.
Was also staffed. I look back in the call log to 9:25, 5:25 p.m., the first call out. And if we could look to the right,
Yes.
was there a successful page to Dr. Wilson's cell phone recorded there?
Yes, there was.
And what time was that at?
At 5:25.
Okay. Was there a second successful page as a result of this entry?
Yes.
And what time was that at?
5:34.
Okay, Doctor, so we have the the call came in from the hospital at 5:25, and the answering service sent out a successful page to Dr. Wilson's, and it indicates a cell phone. Again, at 5:25 and at 5:34, correct?
Correct.
As a result of the call by Nurse Megan, Doctor, at 5:45, that second entry on the call log, was a successful page sent out to Dr. Wilson's cell phone.
Yes.
And what time was that at? You see that just above the bottom entry there?
Yeah, contact attempt. That was 5:40.
You say 5:46, right? And Doctor, could you hold that up for the jury so they can see that? They're gonna see it eventually. I want them just to see what you're referencing.
These are the calls that we referenced, and these are the details and the success of reaching him on a cell phone or home phone.
And Doctor, I forgot to mention, going down to this 5:25 call again, there's also notation that the action rather than Page tried to call Dr. Wilson, is that correct?
Yes.
And what does it indicate in that regard?
Yeah, there was a call made to his cell, call made to his home,
At what time?
5:46.
Okay, so in addition to paging him, they called both his cell phone and his home number, correct?
Correct.
Okay, and doctor, if we go up to the third page that went out to Dr. Wilson at, 5:56, it was initiated by Dr. Azam's staff.
Correct.
Was there a successful page as a result of that call into the telemed call service?
Yes.
And what time was that?
5:56.
Were there any other successful pages as a result of Dr. Azam's call into the answering service?
Yeah, 6:10.
And Dr. Henderson noted 6:14, 7:14.
Yes?
I'm sorry, 6:14, 18:14. Can you read that, Doctor?
Vicky Bizzuto stated, if we are unable to get Dr. Wilson to page Dr. Michael Cunningham.
Okay. So at some point, somebody got a hold of this Vicky Pizzuto, who told them to call Dr. Cunningham.
Correct.
They couldn't reach Dr. Wilson.
Correct.
And Doctor, based upon your review of the depositions, what's your understanding as to how the paging or the on-call system works in Dr. Wilson's office?
If a physician needs to get in touch with Dr. Wilson, they will call the number, the office number, which gets transmitted to Telmed, which picks up the calls after 5 o'clock. And Telmed is responsible for reaching out to the doctor.
That would be the doctor on call.
Correct.
In each of these instances, which doctor did Telemed reach out to?
Dr. Wilson.
Okay, and Doctor, I may have covered this, I may not have, just in case. Did Dr. Wilson call back at any point in relation to his pages out that were initiated by calling the telemed by Dr. Azam?
No.
The other one. Doctor, what time did Dr. Wilson finally call?
9 o'clock.
And that would be just under 4 hours for his initial page at 5:05, 5:10 p.m.
Correct.
And what happened when Dr. Wilson called into the hospital at 9 p.m.?
He had looked at the electrocardiogram from 5:05 and had spoken to Dr. Cunningham and expressed concern about that EKG and her status, and thought that a transfer to a tertiary healthcare facility was appropriate.
Okay. You mentioned Dr. Cunningham. How did that, was Dr. Cunningham called as it relates to Ms. Melissa's condition?
Yes.
Okay. And, when was, does the telemed record reflect when Dr. Cunningham was paged?
I don't believe so.
Give me a moment. It does indicate, however, that at 6:29, Dr. Cunningham is aware.
Okay.
Okay, 6:29.
Fine.
And there's a note here that indicates at 6:14, that Vicky Bizzuto, as you indicated, told the answering service to call Dr. Cunningham if Dr. Wilson was not available. Do you recall that?
Yes.
So within that 25, 30 minutes, Dr. Cunningham was able to call the hospital, correct?
Correct. Well, it was 6:14, the call that was made to Vicky Bizzuto, and Dr. Cunningham called back at 6:25.
So Dr. Cunningham was able to call back at 11:11.
Correct.
In your opinion, based upon your review of these materials, was Dr. Cunningham on call for this patient?
No.
And why don't you just discuss the care rendered after Dr. Wilson became involved after 9 p.m. that night? To Mrs. Wilson.
A call was made to University Hospital. You need to have an accepted physician on the other end, and the case was discussed, and arrangements were made subsequently to have her transferred to University Hospital.
And how quickly was that transfer made, do you recall?
From the time of the initial call of Dr. Wilson's involvement at 9 o'clock, I think she was transferred approximately 10:30, so it'll be an hour and a half. Yeah, she was transferred at 10:20 p.m.
Okay. And Dr. Wilson, do you know if Dr. Wilson had to make arrangements for UH to be admitted?
No, the accepting physician usually does that.
Any of that, doctor, why was it important to get Mrs. Bellissimo to University Hospital?
She was an elderly female with multiple medical problems who was having an acute cardiac event as manifested by the changes in the EKG and the rapid and irregular heart rate or atrial fibrillation.
And what was the definitive treatment for? What was his plan in the UH according to your review of this?
She was admitted, she underwent an electrical cardioversion to help stabilize her, and then she was brought to the cardiac catheterization laboratory.
Were they successful in treating her UH?
How do you define success? I mean, they got her rhythm back to a regular rhythm, and they were able to identify a critical blockage in one of her coronary arteries, and she had a successful angioplasty.
Okay, I guess what I mean is, to ask you, doctor, let's go back. What was her condition upon getting to University Hospital?
She was in bad shape. She was in shock, basically.
What does that mean?
Her blood pressure was low, and she had metabolic abnormalities that indicate decreased perfusion to her organs.
Were those medical issues or conditions that began after 5 p.m. at TriPoint?
The process started, but as manifested by her blood pressure, no, and there was no evidence in terms of blood work, but it wasn't all that extensive as to whether or not she was having any metabolic abnormalities.
Why was it so important for the hospital personnel to reach Dr. Wilson regarding Mrs. Bellissimo's condition?
Dr. Wilson had a long-standing relationship, medical and personal relationship with Mrs. Bellissimo. He had just seen her, did a thorough evaluation earlier in the day. Based upon that prior knowledge and that evaluation earlier in the day, it was appropriate that he was the one to make the call regarding her care. He knew her best, and it was appropriate that he make the call as to the best treatment for her.
Does that meet the standard of care?
Yes.
Doctor, do you have an opinion that based upon a reasonable degree of medical probability and certainty as to whether or not Dr. Wilson breached the standard of care in his medical care and treatment of Mrs. Bellissimo?
Yes.
What is that opinion mean?
His failure to answer his pages in a prompt manner and deliver more definitive care directly contributed to her demise.
Doctor, so we have Dr. Wilson being paid first at about 5:05, 5:10, correct?
Correct.
Would it have been reasonable to initiate some efforts to try to stabilize the condition after that?
Yes.
What does that mean? Why don't you tell the jury?
Ideally, it would have meant an in-person evaluation from a doctor who knew her best. Which means going in, examining her, taking her history, seeing what the condition is, looking at the EKG, interacting with the nurses. This lady was critically ill, and making a plan with regard to further interventions, further testing, and ultimately transfer to a tertiary medical center.
Doctor, we didn't talk about something called troponin. What is troponin?
Troponin is a protein that is released by the heart muscle when there is damage or injury to the heart muscle.
And when it rises, there's injury, is that correct?
When it rises, it often indicates injury or damage to the heart muscles.
Was there a change in Ms. Belissimo's troponin?
At about 556, there was an increase in the troponin level, yes.
Doctor, based upon your opinion within reasonable medical probability and certainty, after an attempt to maybe stabilize the patient for a brief period, is it your opinion that, strike that word, I just want to rephrase it. Doctor, based upon your medical opinion, should Mrs. Bellissimo, given her clinical findings at the time of between 5 and 5:45 p.m., should she have been transferred to University Hospitals?
Yes.
And doctor, why couldn't they handle her condition at Tri-Tri?
I don't know what the capability of doing an acute cardioversion was. They certainly had no capability of doing a cardiac catheterization for diagnostic purposes and, if necessary, therapeutic purposes.
Doctor, do you have an opinion that based upon a reasonable degree of medical probability and certainty that the breach of the standard of care by Dr. Wilson was a proximate cause of the death of Ms. Bellissimo?
Yes.
And what's that opinion?
The delay in transferring her for definitive treatment caused her death.
And doctor, where do we get every hour after 5 o'clock or say, or after 5:30?
It's well accepted in cardiology that there are certain conditions where immediacy is vitally important. And every half hour, every hour, if this woman had a heart rate of 130 to 140, and her EKG continued to show ischemic changes, the ones I demonstrated to you, every half hour, every hour that those conditions continue increases her chance of dying as a result of her cardiac status.
We are back on the record, time now is 11:15.
All right, Doctor, your agreement's better, we just met earlier today.
Yes.
We'll be having some questions, follow up on a few things from earlier this morning. Regarding Ms. Bellissimo's medical history, you went back to, it appears about 1996 when she suffered her acute myocardial infarction, right?
Correct.
All right. And you saw that Dr. Wilson had taken care of her from 1996 after that myocardial infarction up until the time period in September of 2018, right?
Correct.
And you had an opportunity to look at Ms. Bellissimo's outpatient records.
Yes.
All right. We can agree she had a very complex medical history.
Yes.
In 1996, she had this heart attack, myocardial infarction, and they initially treated it with PTCA or angioplasty, right?
Correct.
And those are basically balloons to open up the arteries.
Correct.
And that was in June of 1996. And then by July of 1996, those opened arteries were closed and she needed the 5-vessel bypass.
Correct.
All right. And I think from the record.
Can you hear me better now? Okay.
All right. And doctor, so she had, this 5-vessel bypass in July of 1996, correct?
Correct.
And as you've reviewed your record, she had a left internal mammary artery bypass to her left anterior descent, right?
Correct.
And that's the left anterior mammary arteries, basically arteries that you utilize for bypass grafting, that has very good results, true?
Correct.
And that's also known as OMEAT, is that right?
Correct.
And then she had some of her saphenous vein bypass grafted to the back part of her heart,
Correct.
and that went into the circumflex arteries.
She had one circumflex that went to 3 separate marginal branches.
In any event, she had successful 5-vessel bypass in 1996, and she continued to treat with Dr. Wilson for a number of years, right?
Correct.
As time went by, she developed carotid artery disease that she had initiated, or that you had indicated earlier today.
Correct.
And based upon your review, she had 100% occlusion on her right external carotid artery, right?
Correct.
And when we talk about when we talk about the carotid artery, we're talking about the arteries that come up through your neck and feed your brain, right?
Correct.
And she had 100% occlusion on the right, and at some point prior to 2018, it was 60-70% occluded on the left, right?
Correct.
You also saw that she had peripheral vascular disease throughout her entire circulatory system, right?
Correct.
In fact, when they did the catheterization, she was known to have severe aortic disease near the bifurcation of the iliac artery.
Correct.
And needless to say, that's consistent with the complexity of her medical problems, correct? She had known COPD, which is chronic obstructive pulmonary disease. She had right-sided pulmonary issues from her right side of her heart, right?
Correct.
She had congestive heart failure, true?
Correct.
And she had a number of different admissions for her exacerbation of her congestive heart failure, the years or two prior to her admission to TriPoint in September of 2018.
Correct.
She had been seeing wound doctors for chronic cellulitis due to her arterial disease in her lower extremities.
Correct.
And explain to the jury, what's that from?
Usually, something mechanical, you hurt your foot and there's an infection that sets in, or it's due to poor circulation.
And we know she had poor circulation.
Correct.
And she had these chronic wounds for years prior to 2018.
Correct.
She had, also had osteoarthritis in her knees that you saw, right?
Yes.
She had seen numerous orthopedic doctors over the years, but they wouldn't do surgery on her because of her risk factors, right?
Correct.
And then you talked about the diabetes. She had long-standing type 2 diabetes, right?
Yes.
I mean, I think when you go back in history, she had it for over 40 years.
I don't know the exact amount of time, but it's chronic.
And she was seeing endocrinologists for it.
Yes.
And as the diabetes developed over the years, and her cardiovascular disease developed over the years, she ended up having an increase in the creatinine, or her levels of her kidney function, right?
Correct.
And that was indicative that she was going into renal failure.
Correct.
And so by 2016, she started the need for hemodialysis.
Correct.
And just so we're clear with the jury, that is for what?
That is to rid the body of various toxins that are normally released in normally functioning kidneys.
Right, and so as the kidneys fail, they go from stage 1, stage 2, stage 3, stage 4, and then she was at stage 5, and to live, she needed to take dialysis from 2016 to present 3 times a week, right?
Correct.
And that's a procedure where she had a
Fistula.
place where they can clean her blood, throw it through a dialysis machine, and take the toxins out that aren't being removed by the kidney, and remove it so she can have, basically, to be able to function.
Correct.
Did you happen to see the medical records of her, practitioners when she was traveled down to Florida?
No.
You did not? Your understanding, and at least looking over Dr. Wilson's, records, that she was being treated by a number of different physicians while she was, taking winter, vacations with her family, and lived down there over a few months with, a number of different practitioners when she was in Florida?
Yes, it's also part of the depositions from her family.
Right. So she was seeing cardiology in Florida, she was seeing endocrinology, which takes care of her diabetes, as well as her, as a nephrologist who was taking care of her kidneys,
That's correct.
on top of whatever other doctors she was seeing.
That's correct.
Did you see in the record where she had a right ocular stroke and could not see out of her right eye?
Yes.
Because of the renal disease, there were a number of hospitalizations where she was anemic, correct?
Correct.
And when we talk about anemia, she had low red blood cell counts, where she needed actually iron and transfusion, right?
Correct.
And you saw the fact that in 2017, she had been admitted to Lake Hospital for approximately a week with congestive heart failure?
Yes.
And when a patient's admitted to a hospital for congestive heart failure, just explain in general what that process is, would you please?
A patient presents to the emergency room or their doctor's office with signs and symptoms of fluid overload. And in her case, it was due to decreased heart muscle function, and it's best taken care of in the hospital, and one gets treatment for that.
And that would be basically putting her on some diuretics to draw some fluid, and so on and so forth, as well as cardiac medication to increase her heart rate.
Yeah, in her case, she was not able to make urine, so it would be changing dialysis regimen.
In fact, by 2017, her kidneys wouldn't function to make any urine.
Correct, or it was decreased.
And then in June, you saw in June of 2018 that she was admitted again to University Hospital Richmond campus for exacerbation of her cardiac issues.
I didn't see that one, no.
Needless to say, she had a long-standing, complex medical history, true?
Yes.
And not even walking into dialysis was falling on July 25th of 2018. September 25th, 2018. She had a decreased life expectancy due to her significant comorbidity.
Yes.
And Doctor, we can agree that cardiologists can have patients who die with proper therapy, true?
Unfortunately, yes.
And you can agree that a bad outcome is not a mean malpractice, true?
Correct.
You've reviewed other medical malpractice cases for Mr. Lyken in the past?
I believe I have, yes.
And you've actually come to Ohio and testified for Mr. Lyken over the years, right?
Yes.
And in each of those cases in which you came to Ohio and testified on behalf of a plaintiff when you were working with Mr. Lyken.
That's correct.
And you've also worked with members of his old law firm over the years, in which you were an expert on behalf of the plaintiff.
Correct.
You've never testified in Ohio for a physician doctor, correct?
No, I have not.
When you went back through your practice earlier today, you stopped doing catheterizations well over 10 years ago, right?
Correct.
You stopped doing cardioversions well over 10 years ago.
No, I still do cardio. If you want, I can explain.
I wrote down what you had said, and you said that you had, there was a time that you did cardio.
Yes.
So, are you still doing those currently?
I order them and I supervise them, but I don't directly do them for other reasons.
All right, well,
Do you want to hear the reasons?
no, I don't think it's too pertinent to the issue here.
No, it's not relevant at all.
Then we'll save the jury some time and get to the issues. Needless to say, you are not an interventional cardiologist.
That's correct.
You're not an invasive cardiologist.
That's correct.
Your practice is, the great majority of your practice is in an office setting, right?
Correct.
And, you mentioned you see patients 8 to 5, that's not 5 days a week, true?
No, it varies.
Right. In your website, on the hospitals we work, it indicates it has a mark on there that you do telemedicine.
Yes, I do.
Is that something that you've started, working on in more capacity over the last 2 to 3 years?
Since the pandemic, there are many patients who do not want to come into the office. Since the pandemic, there have been situations where we discourage people to come into the office. If they're testing positive for COVID, if they have a family member who has COVID, we discourage those to come into the office. That doesn't mean they can't be seen and telemed, either in person or by telephone. It's a very convenient way to see them.
Sure, so your office practice would be partially in person, and your office practice would be partially telephone.
It's predominantly in person.
Do you do the telemed from your house, or is it always from your?
When COVID was very active and the office was shut down, I did it from my house. I haven't done that for over 2 years.
You take calls currently?
Yes.
You will agree, when you're off call, you are not responsible for your patients, true?
I'm always responsible for my patients.
All right, so 24/7, 365 days a week, you're responsible for your patients, true?
Correct.
Okay. If you're not on call and a hospital calls you for a patient of yours that's been admitted, you may be off the phone for an hour at times, correct?
Correct.
I mean, I think you have obviously pastimes besides being a physician.
Yes.
You play tennis, you hike.
I do both.
Sure. So you may be off call for more than an hour or two, where somebody may be trying to contact you from a hospital. But you would agree with me, when you are not on call, you're not medically responsible to return that call, correct?
Define what you mean by medically. I have a responsibility to my patients, and if I get a call, even though I'm not on call, about them, I will try my best to respond to that call.
Correct. There are times when you get a call where you are unavailable for an hour or two, where you do not return that call.
That's correct.
And when you do that, and you're not on call, you are not acting unreasonably, true?
Correct.
Now, there are times where you may not be on call, that a patient or a healthcare provider may contact you, and you try to do your best to respond to that, true?
Yes.
Okay. But when you're not on call, we can agree the standard of care does not require you to return a phone call within the 15 minutes, 30 minutes, or an hour, or 2 hours, true?
It depends on the nature of the call, it depends on who's calling me.
Okay, well, we can assume in general, when you are not on call, you do not have a duty to respond to that call.
I have a professional duty to respond. If a healthcare provider calls me repeatedly, I will call them because there's something urgent that they need help with if it concerns one of my patients.
Sure. And if you're not able to be reached in that time period, whether it's 15 minutes, a half hour, 2 hours, 3 hours, you don't have a responsibility to contact them until you become aware of it.
Obviously, if I'm not aware of a phone call, I don't have a responsibility. But if I'm playing tennis and my phone rings, I don't ignore that phone call, and if it's a colleague, I'll simply stop what I'm doing and respond appropriately to the individual who's calling me.
Understood, but if you're not aware of the phone call, the standard of care does not require you to return that phone call, correct?
If I'm not aware of the phone call, there is no standard.
Doctor, I'm assuming you travel with your family, right?
Yes.
And when you travel, do you take phone calls if you're out of state,
Yes, I do.
out of the country?
If the time element is such, I do.
But again, there might be times when you're unavailable for a number of hours, where if you don't know the call, it's not your responsibility to call back.
That's correct.
When if you have a patient on the floor and you are not on call, the nurse at your institution in Danbury, should call the cardiologist that's on call.
Correct.
And ultimately, if the physician does not call, that's making decisions for that patient.
Correct.
Now, assuming Dr. Wilson was not on call, assuming he was not on call, we can agree you don't have any criticism of his care and treatment, correct?
If he got the call, if he got repeated calls, if he got a call from a colleague regarding an urgent patient, I think it's his obligation to call back and to either state, I'm not on call, you need to call this doctor, or this is what, I would do.
All right, so let me go back to my question. We can agree, if Dr. Wilson was not on call on the evening of September 25th, 2018, we can agree that he did not deviate from the standard of care. You can answer.
No, I think if he got the call, if he received the calls, plural, with an urgent stat sense to them, I think it's his responsibility and obligation to return that call.
All right, if he did not receive the calls, we can agree he did not deviate from the standard of care, correct?
If he did not get the call, if he did not know that somebody was trying to contact him, that's correct.
And you're assuming if he was not on call but got these calls, if he contacted a healthcare provider to indicate to them to contact another physician, that would be reason. Is that true?
Yes.
And we can agree from approximately 5/12 up until, I believe it was 6:09, were the time periods that, according to the records that you went over earlier today, were the time periods that he was attempted to be contacted by a number of different individuals. Is that true?
That's true.
From 6:09 until 9 o'clock when he spoke with Dr. Cunningham, you would agree there's no indication anywhere in this record that he was attempted to be called, true?
That's correct, but he did speak to Dr. Cunningham at 7:36, not 9 o'clock.
Where's the record to say that Dr. Cunningham called Dr. Wilson at
I think it's in part of Dr. Cunningham's deposition.
All right, well, we'll let Dr. Cunningham testify to that. We'll figure that. On the medical record, there's no indication that Dr. Wilson was contacted at any time after 6:09, up until the time that he spoke with Dr. Cunningham. Can we agree to that?
I'm sorry, state that again?
Yeah, from 6:09 up until the time that Dr. Wilson spoke with Dr. Cunningham, there's no indication that he had been contacted, true?
That's correct.
Now, Doctor, when you review cases for plaintiff's counsel, you're obviously paid for your time, right?
Correct.
It's about $500 per hour to review
That's
cases. $7,500 for trial testimony,
Correct.
and that's what you're doing here today?
Correct.
You're teaching currently as a voluntary basis, you're not paid for that, right?
No, I understand for it.
You've registered yourself with medical services where you're utilized and called by medical legal brokers to review cases, right?
Correct.
You've actually gone to the point where you've registered as an expert, so you can get business from these brokerage services?
I have terminated one relationship, and the other I have not utilized in several years.
But at some point, you registered yourself to get cases
Yes,
for these.
yes.
One was New England Medical Legal, and the other one was Med, right?
Correct.
Now, going back to September 25th, Ms. Bellissimo was seen in the ER around 6 in the morning, right?
Correct.
And Dr. Lele was the admitting physician.
Yes.
And Dr. Lele is a hospitalist or internist?
Hospital.
And hospitals, just so the jury's clear, have training through internal medicine, right?
Yes.
So when we talked about your training, you have a residency in internal medicine, then you did a couple more years cardiology.
Correct.
And some doctors go through internal medicine, cardiology, and then do further study in interventional cardiology.
Correct.
You never did that.
Interventional was part of my general training in cardiology.
Now they have a subspecialty, true?
You have to do an additional year, 2 or 3.
All right, so, as an internist, internal medicine doctor, Dr. Lele would have gone through a 4-year residency.
I don't know what her training is.
And then, when the patient was admitted, she was also, seen by neurology.
Correct.
And that was a consult that was requested by Dr. Lele.
Correct.
And the patient was seen by neurology, and they were gonna order an MRI, and they wanted to do some lumbar spine, because they were concerned about neurological issues, right?
They were concerned that the fall was neurological in origin.
Patient was also consulted by infectious disease, right?
Correct.
Now, your understanding of infectious disease training would be, again, 4 years of internal medicine, then an extra fellowship in infectious disease.
Yes, the length of time I'm not aware of.
Anyway, their background training is the same as yours outside of cardiology and internal medicine.
Correct.
And Ms. Bellissimo was asked to be consulted by infectious disease due to her wounds on her lower extremities, right?
The cellulitis you referred to earlier.
And then Dr. Lele asked for cardiology consult with Dr. Wilson, and also asked for nephrology consult with Dr. Aza.
Correct.
And again, nephrology is the study of kidneys.
Correct.
They too would go under a 4-year internal medicine and then do a fellowship and study just focusing on the kidneys.
Presumably, the training is 3 years, it's not 4 years.
In internal medicine.
Correct.
And all those physicians evaluated Ms. Aza, all those physicians, Dr. evaluated Ms. Bellissimo on September 25th.
Correct.
And you saw their consultations, right?
Yes.
You saw where they documented, these physicians documented their physical exam, that she was not complaining of chest pain, right?
No, she did have some chest pain upon admission.
You saw the record, the consult note by Dr. Cox, who was infectious disease.
Yes.
And, she indicates in her note that, she denies chest pain.
Correct.
You saw the consult note by Dr. Akers, nephrology, that she denied chest pain.
Correct.
The
What I'm
pain-
referring to is her initial presentation in the emergency room. She complained of chest and back pain.
Right. In fact, Dr. Laley, in his notes, didn't he indicate that he thought the chest pain appeared to be secondary to the fall,
Correct,
not cardiac in nature?
correct, but she did have chest pain.
Chest pain she had, based upon your review of the record, appeared to be related to the fall and not cardiac.
Correct, it's just for the record, she had chest pain.
Thank you. Again, Dr. Wilson saw this patient, you would agree that, we'll strike that, the care that you saw regarding Dr. Wilson's care of this patient over those 20-some years, you don't have any problems with the care he provided.
No.
It was thorough, appropriate, met standard care.
Correct.
When you saw the patient on the morning of September 25th of 2018, we can agree that the history that he took when he saw Ms. Delisimo was thorough, appropriate, and met standard care, correct?
Yes.
The physical exam that he performed on her when he did his consult on the morning of September 25th was appropriate, thorough, met standard care.
Yes.
And then the orders that he either made or that he agreed to about stopping the metoprolol were all appropriate, true?
Correct, yes.
Now, it looks like from the dialysis record, this patient was in dialysis up until approximately 4:15.
Correct.
And it indicates during the dialysis that she had no complaints of pain, right?
Correct.
And then she was taken back to the floor, and at 5 o'clock or so is when she had this bout of atrial fibrillation,
Yes.
and her heart rate went up.
Yes.
When the nurse noted that there was AFib and a rapid heart rate, it was reasonable and appropriate to order that EKG that you showed the jury from 512, right?
Correct.
There's a number of causes for ST elevations, right?
Yes.
In a patient with her history of previous myocardial infarction, previous five-vessel bypass grafting, and her long-standing cardiac history, when you're stressing the heart with a rapid heart rate, you can get ST elevation, right?
Typically, you get ST segment depression, you don't get ST elevation.
If you have ST, if the posterior portion of your heart has been bypassed, as she had, right?
Yes.
Can you have reciprocal ST elevation in certain leads?
Yes.
And so when the patient's EKG was evaluated at 512, it was appropriate for whoever to order the patient to be sent to the ICU, right?
Yes.
In the record that you were showing earlier, the patient was sent to the ICU, that was based upon a physician's order, right?
Yes.
As to what physician ordered those, are you aware?
No.
We can agree there was a house physician on site on the 25th of 2018.
Who was that?
Dr. Erdman.
Okay, Erdman.
So we can agree that Dr. Erdman was called at or around that time period after the EKG to evaluate the patient, true?
She was told to evaluate the patient. I don't have the documentation of that actual evaluation.
living?
We're just a very tight family, very close. You know, things are a little bit different now. Kids are moving and everybody's a little bit further, but back then we were all pretty close.
How old's your father?
I want to say 85, somewhere in there. Yeah.
Does he reside?
He just moved into assisted living off of 615 Vitale. It's a assisted living.
And you said, Jess, when did you move into that facility? Is it in Manor?
It's in Menor. I believe he moved in there December, right before the holidays, somewhere in there, or right after the holidays, somewhere in there.
And your dad used to spend some time in Florida.
Yeah, he still has a condominium in Florida. I actually owned one in the same development for years, probably about 20 doors down from theirs. But they were going down there since 1985-ish, somewhere in there, or 90, somewhere in there.
Okay, why don't you tell the jury a little bit about your mom? Going back and forth to Florida over the years when I take it they did that after they retired.
Yeah, as soon as my dad was fortunate to retire at 55, he worked. He was in the service in the Navy, and then he worked for Cuyahoga County Engineers. So that gave him the ability to retire a little bit early. So he retired at 55, and right after that, they bought a place in Naples, Florida, to spend winter, obviously, to get out of the snow here. And they continued to go there every year up until she died. And they used to drive it. They didn't fly because they had a dog. And I think the last maybe 2 years, she said no part of driving anymore. So she flew, he drove.
Tell the jury a little bit about your mom.
About my mom?
Yeah, what was her background, education, where she lived, grew up?
Yeah, she's, I think, third generation. She's from Wickliffe, Ohio. Her whole family's been from Wickliffe. Still have a lot of family there. She graduated high school, went to a community college for some time as secretarial, I think, somewhere in there. And obviously she got married to my father. And then she just took on like bookkeeping jobs for local companies after that, and primarily was just a stay-at-home mom, besides working that part-time stuff throughout her life.
Was your dad married?
Correct, yes. Yeah.
Was she in her early 20s when she got married?
Yeah, I believe so. I don't, but yep.
And did your mom and dad spend a lot of time together?
Yes, yeah, quite a bit.
Currently, how's your dad doing?
My dad is fine. I mean, he couldn't manage a home anymore, so he agreed to move into the assisted living, which he's much better off at his age. You know, I mean, obviously, you know, losing a spouse, we all can imagine it's tough, and ultimately, a lot of us will go through that. But certainly, he reflects every day to his phone, pictures, those kind of things, and I think it can contribute to their diminishing ability to remember things and things of that nature. So we're seeing some decline with him, and that's why we made the choice of getting him out of the house into a more protected place.
You mentioned your mom worked part of a full-time job?
You know, she might have worked full-time for a bucking equipment company here in Willoughby. She might have been full-time. She maybe a couple jobs out her tenure of work. Not all of it was part-time.
Your mom had her heart attack.
Yes. You know, obviously, you know, she had, you know, chest pain. She went and got checked, blockages, and tried to do the angiogram. We had open heart surgery, which, you know, was the only time she had open heart surgery or any kind of, I guess, a procedure directly to her heart.
That was the first procedure, you said.
Yeah, to my knowledge.
How did she do leading
I mean, like any other issue, I mean, obviously, we've heard her health has declined over the years, and, you know, she wasn't 45, she was 78 or 79, and all the ailments that she had, she was a very self-aware person, and, you know, she had doctors here, she had doctors in Florida to match, she went to every appointment, she took caution on everything she felt or did, she would go to the hospital when she wanted to, or when she felt it. She didn't mess around with her health. And I think she lived her life pretty pure when it came to just that self-awareness of where her health was. And, you know, and she rebounded from that, just like she rebounded from every other episode she ever had, quite well. But, you know, she did have some issues.
Prior to the confines of disclosure, did you ever meet Dr. Wilson?
Yeah, so we heard, you know, in 96 kind of time frame, but it kind of goes back further than that. I believe we probably first met Dr. Wilson, the early grandfather's cardiologist, and my grandfather passed away in 85. So we knew Dr. Wilson back in the 80s. Great guy. I mean, our family adored him. My great uncle had him. A lot of our family members also used him. My brother, you know, all great experience throughout our time, but I think, you know, socially and professionally, we've known him since the 80s.
Prior to 2018, your relationship or your experiences with Dr. Wilson were good?
Yeah. I mean, for me, it was non-existent. I mean, I never saw him as a patient myself, or never had any bad feedback from my parents. And I mean, I think it was contested that they've gone to their appointments. They never missed appointments. They always went on checkups. They've always seen Dr. Wilson, and to them, he was the guy.
So, prior to, say the year before 2018, what was your mom was like? What was her activity level? Was she independent? Was she dependent on people? Please let me.
Sure. So, unlike my father, where he doesn't drive anymore, I mean, she was driving, she was going shopping, she belonged to the Italian American Club, she had girlfriends, I mean, they played cards, she shopped, she cleaned, we have a 2-story house, laundry in the basement, you can see how tough that could be, but up until the day she died, she did all of that, and she didn't stop moving, and she didn't stop being social, and she didn't let any ailment that she had prevent her from doing anything she wanted to do. Yeah. No, she did it herself. Never hired a cleaning person or did anything like that. And, you know, Italians like to clean a lot, so she spent a lot of time cleaning. Correct.
Talk about a widow a lot. Did she have a certain amount of devotion to her community?
Yeah, I mean, you know, I think there's some background there. I mean, you know, I mean, she always said, and she did it obviously, but she always said I was hatched, matched, and she'll be dispatched from the house, you know, from Wycliffe, and that's what she did. She was born there in a house, she lived there, and obviously she died there, you know, living in the same house. Yeah, to some extent, some social with church she was involved in, and, you know, like I said, the Italian American Club, which my grandfather founded years ago. She was a big part of that. Yeah, so my sister had the grandchildren first. You know, obviously I just had one 2 years ago, or a year and 8 months ago. But my sister had two very quickly, married very early, and she followed the same suit as she did with us, with them, whether it was a school play or vacations in Florida, right? Because when you have kids, you go on vacation where you can go, and that's the place to go. So yeah, very active and very engaged with the family. Her house, there was no option there. And we all had Christmas, Thanksgiving, Memorial Day, July 4th. They had a very nice house with a nice pool, and that was their kind of thing, to have people there and have the family there. It was important to them. Yeah, we continued these parties. I mean, I was away for like 8 years, Dave and I. But certainly we both moved back in 2008 after we sold our business, and all that continued. And even when we were gone, they still had parties and get-togethers. Correct. Yeah, so, you know, I was already at work, so I get to work usually around 6:30 or 7 o'clock. Okay. Yeah. My employment history. Okay. Sure. Yeah. Absolutely. So, yeah, after I graduated at Kent State University with a criminal justice degree, I moved to Maryland, and I worked at the U.S. Department of State in diplomatic security. That was my first job out of high school or college. I stayed there for a little bit of time, and we heard it, but my wife was not interested in moving overseas, and that was what foreign service was. So I made the decision not to pursue that career any further. So I came back to Cleveland, and my first job was with a company of a friend who owned a seafood business, a purveyor who sold the restaurants. And then shortly after that, I joined up with two brothers, Scott and Dean Mueller, who owned Mueller Tire and Brake. Not sure if anybody remembers that, but they were the predominant retailer of tires in the Cleveland market, and I ran 25 of their stores. After, in '99, they sold that business. I left, and I opened up a tire store of my own, and then a used car lot, and then I bought a Kia dealership, and had that from 2000 to 2008. I sold that, and I came back with Scott and Dean and I'm a vice president of a company called Dealer Tire, who's here in Cleveland. It's a very large company that not many people ever heard of, but we supply all the tires to 23 car manufacturers like Toyota, BMW, Mercedes. So if they all need tires, they get them from us. So you probably never heard of it. Yes. Correct. It was on Chester Avenue, Cleveland. Yeah, so I did get a call, and I believe it was from my niece Jenna or Jenny. Either one of my nieces, I think they were there along with my father, and they told us that she had filed at dialysis. So at that point, I stayed at work, obviously, because they had 3 people there, and they were just keeping me updated throughout the day. My intent was to get down there, but I did have some meetings in the morning and didn't feel I needed to be there right away. She's been in the hospital before, and we've had great support. My sister's kids are all in the profession. One's, I think she's I forget, not a practitioner, but both of them are nurses to some degree. So they're in good hands. So I continue to work. My brother Dave and I both worked at Dealer Tire, and we still do. We both came back to that company. So we were both at work, and we were planning on going in the afternoon at one point, as soon as we can get out of work, or unless we were needed there very quickly, which, in the morning, nothing came about to where we needed to be there. I believe my father was there, Jenna, Duda, and possibly Jamie. I'm not sure if Jamie was there first thing in the morning, but at one point she was there before I was. Correct. Yeah, so I probably left work around 4:15, 4:30, and probably got there around 5 o'clock, somewhere in that area. Yeah. So when I arrived at the hospital, my brother Dave was already there. I got to the hospital, and she was just in a room, I guess ICU, where she was just in a room with my father, myself, my brother, and I think one of my nieces. It had to be Jamie, maybe Jenna left at that point, but nobody else was in that room, just her. And she was coherent. I mean, she was talking, and I mean, she was sitting there. I mean, obviously, she was hooked up to monitors. She looked a little scared. She was a little quiet, but she was articulate. She knew where she was. It obviously was a long day because she's been there since 6 in the morning, right? And then went through dialysis, so it kind of wears you out. So she was kind of quiet, but she was there. But the interesting thing on the whole time we were there, a lot of the monitors were going off right after to see if they can address all the alarms going off on the monitors, and it was probably due to some settings or maybe heart rate or blood pressure. I'm not sure, but the alarms were making a lot of noise, and nobody was really addressing that noise. So he was continually going out, and and I never saw a doctor there. The only doctor that I've ever seen in that room was that hospitalist or generalist that tried to put the IV in. That was the only time I've seen somebody go in there. So nurses, I noticed maybe in and out very quickly, but it was a little chaotic with the noise. It was bothersome. It went on for long periods of time. And my understanding was that they were waiting for a doctor to call. That was my understanding.
Let's go back to
Yeah, just probably before 5, just a little bit before 5. 10:30 till she left. Correct.
So describing, you're describing the time period between 5 and 10.
Correct. The whole time period. Yep.
When you got there at 5 o'clock, you recognize you.
Yes. Yes, but fuzzy. I mean, very kind of quiet. But yeah, she knew who I was. She knew who she was. Mm-hmm. Well, the biggest event. Okay. Yes, and this was at 7 o'clock. There was a nurse change, and there was a nurse that came in, and it was like an aha moment for this nurse that says, "Why is this woman here?" I mean, she wanted this person. She said she should not be here. There's something going wrong with her.
Objection sustained. Jury is instructed to disregard that answer.
That was when there was a time change. Yep. Yep. I personally observed the nurse coming in saying, or nurse coming in, and then things started to elevate as far as trying to get her to get out of that hospital.
When the decision was made to get you out of that hospital, in the room, you were there?
Yes.
What went on during that period?
Well, they came in and they said they're ready to, they want to transport her to UH. They were calling for a life flight to come and get her. So
Objection. Objection sustained. You cannot, Mr. Polisman, you cannot state what other people said. You can always talk about your observations and what you said, okay?
Let me ask you this question.
uh-huh.
Did you have an understanding that they were trying to arrange for a life flight for your mom?
Yes. Whether it was bed and the arrangement was an ambulance. Yes. Dave and I left at the same time. We dropped his car off at home, and then we continued down to UH together. And Jamie went to UH. Jamie dropped him off at home. He was completely exhausted, and he was not going to be able to withstand, going all the way downtown at that point. Sometime after 11, not quite sure on the time, but it was late.
So I want to try to be careful, you need to define your assessment and what you observed.
Mm-hmm.
Basically, what happened at University Hospitals?
He was already, when we got there, he was already up with the doctors or in a room. She was already up in the room, sorry, with, at university when we got there. Jamie told us where to go. We went up and we waited for the doctors to come and talk to us at that point. I was not there when I don't know the route she took to get to the room, because by the time Dave and I dropped the car off and got there, she had already gotten there ahead of us. So by the time we got there, my recollection is she was already up in intensive care or some cardiac care part of it. I'm guessing that's where she was. I don't know the name of the room she was in. Yeah, we were in a room with her, and it was kind of, again, I think she was a little more quiet. She was a little more nervous, I think, at that point. But she still was coherent, and she still was talking. I'm not sure. I don't know. If somebody make decisions, if she can't make a decision, I would imagine she might have had one. I don't know.
Anybody make decisions for your mom?
Well, ultimately, Dave and I made a decision to do that procedure to get her heart rate back in rhythm. Ultimately, by the time we talked to the doctor, the doctor had two options: one medication and one the shocking treatment. And the playbook was the shocking version because medication would take too long to do. He needed hours and hours, and she wasn't in a position to wait. So the shocking had to be done, and we called my father, and we told him that they have to get the rhythm back in place, that her heartbeat was out of rhythm and rapid, and they wanted to do a shocking. I forget what the name of it was. okay. We relayed that to the doctors. We went in and saw my mother, and she, funny as she is, she looked at me and Dave, you know, because ultimately we were part of that decision, and she looked at us and said, "Do these guys know what they're doing?" And we said yes. That was the last time we spoke. So it's kind of heavy on us a little bit, but it wasn't like a graceful passing away where, you know, it was Dave and I making this decision because we thought it was the right thing to do. And that's our last experience with our mother. She never spoke after that. And she laughed at it too. She goes, "I hope these young guys know what they're doing." And that was the last word. And it,
Describe it as you began the remaining experience with the University. Did you stay at the house?
yeah, I stayed pretty much till the way early morning. My sister was out of town, so she flew in. I believe I went home just to, you know, shower, or if I recall that. I mean, it's been some time, but I think I left for a little bit and then I went back. Yeah. She may have had a tube in her mouth at that point and laying in a bed. Her eyes were somewhat open, I think. I don't know that to be a fact. I'm not a medical person. I don't recall. I don't remember that. Oh, I think the following afternoon. I know we were all there. Um, and you know, she was just laying there, and I think she may have went into another cardiac arrest and passed away. I think my kids were there, my wife, my brother, his wife, my sister, her husband, my nieces. There was a ton of us there. A lot. Yeah, of course. Yeah. We called him early to be there. They went and got him. Yeah, I don't recall the time.
So, I know you could speak to your mom. Was there any other way you were able to say goodbye?
No.
What is your mom's passing under these circumstances?
Well, I mean, you know, obviously, it's an ultimatum we're all going to face, obviously, and it's the experience you face when you go through it. It is the experience you have, and you know, it was very tenseful for me. It was very tenseful for my brother. It was very tenseful for all of us. And to say it's a good thing to go through, but the whole process was pretty brutal and long. Well, obviously, there's a hole, right? I mean, the family get-togethers are not what they used to be. My father, where he's at, and, so it's quite different. I mean, look, if I would have to pick up a phone call, I call my mom, not my dad, right? I mean, that's what kids do, call mom, so she's not there. So. Yeah, sure.
All right, thank you. Cross-examination.
Good afternoon. Yep. Correct.
I know you talked about this a little bit, but we can agree on that multiple medical problems.
Multiple. Many.
She had cardiac issues.
We know them. Yep.
Including congestive heart failure.
Yes.
Stenosis.
Yes.
Artery occlusion.
Yes.
Were you involved in medical care when she was?
No. Again, my parents were independent of their medical, and they weren't being transported to checkups or doctors. Nobody made their appointments. They did it all themselves. So, obviously when things, when she was at Lake West, or she did have to go to Richmond, we were all involved, because when your parent goes to the hospital, you go, right? Or you get involved. But as far as her maintenance of her issues, well self-aware, well appointed, and well coordinated.
So she took care of those things out.
Absolutely.
And if they were declining and worsening, that was an issue she didn't specify herself.
I'm sure my father and her conversed on, the way things to do when it came to both of their health. Yep.
And because she had peripheral vascular disease, you're aware of that?
What is that? I'm not sure what it is.
Okay. So you're not sure, you didn't know your mom had peripheral vascular disease?
She had heart disease that I know of. She had cellulitis that I know of. She had carotid arteries that I know of. I don't know every single term that she might have had, but if it's in her record, she did. I'm not sure. Yeah. Yeah, I don't know all of them.
You mentioned cellulitis. That affected her lower legs.
Yeah. Correct.
And they would swell at times.
Mm-hmm.
Yes.
Yes. Sorry. My bad.
And because of the problems with her circulation in her lower legs, she also developed chronic wounds on her legs.
They would come. Yes, they would come and go. She would get blisters, and she would treat them. She unwrap them. She would see a doctor about them, and then they would go, and then they could come back, and they were kind of on and off with her. Yes.
And were you aware that she was going to the wound clinic for treatment of those wounds?
Yes, she was getting treated. I was aware of that. I'm not sure where. You said wound clinic. I don't know where that's at, but I know she was getting treated. Yeah.
You know, her wounds were so bad she had to have the actual medical treatment, not just care for them herself.
I don't know the degree of how bad they were, but again, if she had a wound, she would go get it treated. She wouldn't let it just be a wound. Yeah.
You talk about some of the medical problems she knew of. You knew she had diabetes, right?
Sure. Yes.
You knew that she had a chronic kidney failure because of her diabetes.
That was a result of me at birth. Ever since she gave birth to me, she developed diabetes. So yes, I'm aware of that.
And you're aware that the kidney failure as of 2006, she had to start undergoing dialysis.
Correct.
And I think you mentioned under your directive that the dialysis would wear her out.
I believe going through that process, my assumption is it tires you out. I've been to dialysis. I've seen people get it. I've dropped her off. I've sat with her there. I believe that is a tiresome thing to sit through.
Okay. After dialysis, she would be tired, right?
Not all the time.
At times.
Sometimes. Maybe.
She would do dialysis 3 times a week.
I believe it was 3, yes.
Do you recall her investigating whether or not she was a candidate for a transplant?
I did not. I'm sorry.
Did you ever talk to any of her kidney doctors or nephrologists?
No, sir.
Did you ever talk to your mom about any conversations that she may have had with those doctors about life expectancy while on dialysis?
No, sir.
We can agree that during the last years of her life, the frequency of her medical treatment increased.
Yes.
You mentioned that your mom and dad would go to the Florida, or your mom stopped driving for the last couple of years because of her health.
I think it was more of a persuasion from the kids to say, you don't, why would you want to spend 18 hours in a car when you could be there in 2 hours? My dad was get in the car and don't stop until you get there. And he did that until he was 82 years old. Like, he didn't stop. Like, he didn't get a hotel, and we felt get her there first, you know, it was hard to sit in a car for 18 hours. Yeah. I wouldn't sit in a car for 18 hours, so I can't answer that. Why she decided to fly rather than drive. She still could have drove if she wanted, I would imagine. Mhm. Correct. Correct. Been at her house, I think. Mhm. Yeah. Sure. Yes. True. Not at that time. I don't recall specifically what I was told.
During the time you arrived at the hospital, you said today it was around 5 o'clock.
Yeah, maybe just a little before. I don't. Yeah, maybe 4:45, 5 o'clock, somewhere in there, if I remember right.
Okay. And the records show or demonstrate that your mom was transferred from one room into the ICU sometime after 5:15. Were you there for that?
I can't recall which room she was in, but I know I saw her in a room, but I can't recall if she was in one and then got moved to the other. I don't remember.
Did any of the other family members let you know that they had transferred her to the ICU?
I don't recall. I don't remember that specifically.
Are you aware, you said that you only doctor that you saw care for your mom was the doctor that did the IV?
Tried to do the IBS.
I believe that was Dr. Todoranoff. That means something.
Yeah, I knew he was. I thought it was called a generalist, but he was in charge of the 2 or 3 floors. He was the only, I guess, doctor there at that time. Yeah.
And there was another doctor that cared for your mom, Dr. Irvin. According to the record, she examined your mom. Did you ever see her in the room?
I don't recall seeing her.
Did you know that the nurses had contacted Dr. Lele about your mom?
No, I didn't. I did not. He was not there though. They contacted, but they didn't tell us that.
Did you know that they had issued orders for care, for cardiac care?
Not to my knowledge.
Were you aware that the nurses contacted Dr. Zen about your mom's care?
No.
Were you aware that Dr. Irvin had contacted an interventional
called a Dr. Wilson. That's the only one I was aware of.
Why they, wanted to get an IV access to your mom?
Well, she didn't have one all day. Fluids, maybe? I do not know.
Were you aware that they wanted to administer her a medication called metoprolol?
No.
You know what that medication does?
Nope. Nope.
Were you aware that Dr. Urban ordered heparin, compressor, to help with your mom's heart rate?
No, none of the doctors talked to the family at all. Everything was done behind the scenes, and we were never informed, or I was never informed, to my knowledge.
All of this care and treatment according to the records occurred between 5:30 and 6:30. You were at the hospital, and you were completely unaware of anything.
Correct.
Around 6:30, 6:25, Dr. Cunningham became involved with your mom's care. Were you aware of that?
No, it was not.
And based upon being here for a couple days, you're aware Dr. Cunningham is an interventional cardiologist.
Yes.
And now, as you sit here today, you know that he was involved with your mom's care.
Virtually, yes.
Are you aware that he ordered additional testing for your mom?
Was not aware. Again, Dr. Cunningham did not talk to myself, to my knowledge, or my family, to my knowledge.
You said that your brother talked to the nurses. The nurses never told you that all 5 of these doctors were helping with your mom's cardiac condition.
Not me, no. Only we were waiting on Dr. Wilson to call us back. That was the only communication I was aware of.
Your mom receiving medication at Tri-Point Hospital to help lower her heart rate.
Again, I don't recall that. Nobody specifically spoke to me about any drugs, any procedure, or any directive from a doctor. I can't speak for my sister or my brother, but nobody came to me and asked and told me what they were doing. I never seen anybody do anything except for the IV from the one doctor.
You recall seeing the monitor and noting what your mom's heart rate was during the time you were there?
It was in the 150s when I seen it, 140s, 150s when I had seen it.
How many times did you see it like that?
I don't recall how many times I looked at it. I don't recall.
Now, if you bring up defendant's exhibit B1, page 167. Sorry. Just turn the wrong way. Maybe you want to turn that again.
chart?
Monitor.
Or the,
I'm sorry, thank you. You ever notice the monitor reflecting a heart rate of 136?
I'm not I can't pinpoint an exact number of what I've seen, but I recall it being high at a time, higher than normal. Correct.
Did you recall that at 8 o'clock, it was 156 on the monitor?
Again, I can't exactly recall every time I looked at a monitor, and I can't tell you it was at 8:56 or 7:56. I periodically looked at it, but
Do you ever recall the heart rate showing a rate of 118, which is reflected in the records at about 9?
no, I don't recall that exact time.
Thank you, John. You mentioned that you had an understanding that they were trying to lifeboat your mom. You had an opportunity at some point to look through some of your mom's records, right?
Briefly, not extensively.
Anything in the medical records that indicated they were trying to arrange life flight?
That's what I was made aware of by the staff.
And your understanding, if I recall from some of your prior testimony, your understanding is your mom was being transferred to UH to be monitored.
In layman's term, yep.
And on your arrival at UH, your mom was able to communicate,
Yes. Yes.
and she was at UH from around 11 o'clock to around 1:48 until they did the cardio version, right?
Correct.
A little over 2.5 hours.
Correct.
And during that time, she was doing well, sitting up in bed and talking.
She was sitting up and she was communicating. The well part, I'm not sure how you define well. She was in a hospital and kind of quiet, like I said, and scared and wasn't very talkative.
You remember me in your prior testimony, she was doing pretty well during this time period.
She was talking and she was sitting up.
My question is,
I don't recall exactly that. No, I don't recall.
you don't recall it.
Mm.
Before the cardio version was done, you discussed the potential risks with the physician who was doing cardio version,
Yes,
and one of those risks was that it could possibly cause your mom to go into asystole.
yes.
From your understanding,
Yes. Thank you.
Any redirect? No redirect. All right, you may step down.
Thank you.
Next witness?
Will be Karen Duda. I'll have to go get her, Your Honor. She might be in the back here.
I think he's coming in. Somebody's at the door. Will you raise your right hand, please? You swear testimony about gives the truth, the whole truth, and nothing but the truth, so help you God. All right, you have a seat here. And if you could please keep that microphone close to you, you can bend it down if you want a little bit. Okay?
Karen Duda. It's 8043 Belglow Lane, Mentor.
How long have you lived there?
5 years. April 5th, 1965.
I apologize if you're old.
I'm 58, soon to be 59.
Are you married?
I am.
How long have you been married?
It'll be 37 years in May.
Whose first name is?
James.
Do you have children?
I do. girls and a boy. They range in age from 35 to 31. My oldest has a master's in nursing. My middle daughter is a nurse practitioner, and my son works for a company called Dealer Tire. My husband is a director of retail operations for Dealer Tire.
Tell the jury a little bit about your educational background.
My educational background consists of high school. I went to Wycliffe High School and graduated in 1983, and from there I went to Lakeland Community College and Cleveland State. Unfortunately, I did not finish my degree. Yes. As a waitress, briefly until I had children. I did. Yes. Absolutely. She was involved in day-to-day. She was a stay-at-home mom as well until we were older. I want to say junior high age. She went back to work. Active. She was a Brownie Girl Scout leader, those types of things, and very active with my brothers in their sports. I'm sorry.
Did you perceive your mom to be an independent person?
Yes, yes, definitely.
Yeah, did she like doing things for herself? Did she handle her own affairs? Did she handle all the kids' affairs? Could you explain that?
Well, back when we were little, she handled the day-to-day in our household because my dad worked 2 jobs sometimes. So she was very independent, and because my dad worked 2 jobs, he afforded us an in-the-ground pool, and she not only afforded us a great childhood, but half the kids in the neighborhood as well. Very social. Lots of friends. She was a member of the Wycliffe Italian American Club for, many years up until she died. And she joined when she was first married. So my parents would have been married 60 years. So that. Well, my mom growing up was a very dedicated mother. Some background about her. She lost her mom when she was 7 or 8. And I think part of that trauma in her life was, to be the best mom to us that she could be. And she involved us in things. She was very involved at the Wycliffe Italian American Club, church. Things of that nature. Oh, gosh. Every party was at our house because of the pool. If you were a friend, she was the most welcoming person. If you got to know her, she was one of those people that it seemed like you knew her forever. She was so welcoming to everyone in her home. She was that type of person. Every one of them. They were at her home. She hosted Christmas, Thanksgiving, and it was not only for us and our children, it was the extended family as well. Aunts, uncles, cousins. I do. Most definitely. She insisted on Sunday dinners, and that included my siblings and myself and our children. We were together almost every Sunday, when they were in town. They lived later, when my dad retired, they spent 6 months in Florida, 6 months in Ohio. Definitely. When I got married, our first home was one street away. And shortly after, my husband and I, there was available a lot on my parents' street, which was an older street, but it had an empty lot. We ended up building on the same street. So my children spent a lot of time at my mom's, back and forth from her home to mine. Yes, she came to concerts and sporting events and school activities, grandparents' day. Actually, my middle child for the city of Wickliffe sent in an essay for grandparents, and she actually won. My parents were nominated Grandparents of the Year for the city of Wickliffe.
So, let's move on in the years, it's going to, close around 2018, let's say the year before 2018. Was your mom still independent at that point?
She was, even being on dialysis, she still, she did her day-to-day activities. She took care of herself. She cooked. She shopped. She went back and forth to Florida for 6 months. We arranged for her to have dialysis in Florida as well as Ohio. And the only thing that changed with that was, instead of driving with my dad, she flew.
Your mom had a zest.
Absolutely. Well, what gave my mom joy was being around her kids, her grandkids. Nothing brought her more joy than being around her family.
You see, you were the only daughter. What was your relationship with your mom?
Beautiful.
You raise your right hand, please. You swear testimony about to give us the truth, the whole truth, and nothing but the truth, so help you God. All right, have a seat. Please do your best to keep that mic close to your mouth, okay?
The record, we have your full name, please.
David Bellissima.
See, David, I know I'll be asking you the questions, but as best you can, and I know it's awkward, if you could address your answers to the jury, that would be best, okay?
Yes.
What is your current home address?
5149 Charlene Court, North Perry, Ohio.
Could you tell a little bit, ladies and gentlemen, the jury, a little bit about your educational background?
So obviously high school, I went to college, I was just looking at my transcripts, a little bit short of graduating. I took a job offer, so some college.
Okay, where did you go to high school?
Wycliffe High School,
Where did you go to college?
Kent State.
And what were you studying when you were at Kent State?
English and philosophy, and I wrestled.
Give you a little bit of idea of the jury, if you can, of your employment history, if you don't have it.
One of the reasons I stopped going to school is I was offered a job working for a company called Mueller Tire. They're also the same family that owns the company that I work for now. So I've worked for them for 30 years. And there was about a 5 or 6 year period where my brother and I owned and operated our own business. So other than that.
Okay, and the company you work for now is called?
Dealer Tire,
And in 2018, where was that located?
Cleveland, 70th and Euclid.
And when you and your brother had a car dealership together, was that out of town?
Yes, it was in Maryland,
Did you live in Maryland during that time?
2018.
Did you live in Maryland during that time period?
No.
When you had the car dealership?
Oh, when I had the car dealership, yes.
Tell us a little bit about your family. Are you married? Have children?
I'm married. I have 3 children. Well, they're old now, but
And how long have you been married?
26 years.
And your children, what are their ages and their sex?
24, 22, and 20.
And do you have boys or girls?
2 boys. The younger ones are boys, and the oldest is my daughter.
And what are they doing?
My daughter just actually got accepted to Case Western Reserve for to be a nurse anesthetist. So she's a ICU nurse at the Cleveland Clinic right now. And my other son is in college finishing up a history major at Cleveland State. And my other son has 2 years. He took this year off of college, but figuring things out.
And have you lived
And he
your whole
works.
life in the Lake County area?
No, I've like we.
Other than Maryland?
Other than Maryland, I also lived in Southern California in Orange County for 4.5 years.
Could you describe your parents to the jury from your perspective?
I mean, I just look at it through my lens. I mean, I don't know, you know, I had a great relationship with my mother. I have a great relationship with my father. You know, it was instilled in us. I mean, we're very close as a family. I mean, you have 2 things that you can count on, your family and God, you know. And, you know, I feel like I've tried to do that at every step of the way.
What was your mom's role in the family growing up and up until the time of her death?
You know, it was kind of, you know, she was the person that even though I messed up, she would always be there to, you know, kind of, you know, even though Dad got mad and he had to be the enforcer, it didn't even bother her that I was bad, you know, or I messed up or any of that kind of stuff. So she kind of kept everything flowing, right? So when I lived in Maryland, I called my mom every day. When I lived in California, I called my mom every day.
Were you close with your mom?
Yeah, very close.
Was your mom independent?
Yes. Yep. I would say, she was independent. I mean, she, did her housework. She went grocery shopping, up until the day in 2018. Drove.
Did you perceive, had her activity slowed much in 2018?
No, I don't think, I mean, I don't recall anything slowing down. Obviously, when you get older, I even feel it now at 54. I'm not as active as I was in my 20s. So, and I see my dad turning 80, you just, you slow down, but I didn't see anything eye-catching that was slower than normal, abrupt.
David, did there come a time when you learned that your mom was hospitalized at Tri Point?
Yes.
December 25th, 2018?
Yes. I received the phone call. I can't remember who it was that called me initially. I think it may have been my father or my niece. But I was at work, and I headed over to the hospital. Yep.
And do you remember anything specific about the phone call or the fact that your mom was in the hospital?
I knew that she fell at dialysis and she went to the emergency room. It didn't seem anything, I know that there's complications with dialysis, right? So I didn't know if it was just some of that stuff, or didn't really have any information to make a drive at 9 o'clock, right? Dialysis is tough. She did it she never missed it, right? So every now and then there's probably going to be something pop up, but I didn't, nothing indicated that, hey, you have to go to the hospital.
What time do you think you got that call?
I went to the hospital at around 3 o'clock. It's a pretty short drive from where I was working, so I was there pretty quick, and I didn't have anything more important.
Based upon your personal observation, could you tell the jury what was going on when you arrived at the hospital at about 3 o'clock on the 25th?
So when I got there, I don't think she was in the room when I got there, but I went to the ICU floor because I think that's where they were going to bring her. So I was on that floor. She may have come in half an hour, 40 minutes after I was there. Some of the observations that I saw was, she was kind of, I know that they, sedated her, I guess, from what I recall. Not totally sedate, but just relax. So she was kind of in and out, so it wasn't like conversation time, but sensed a little agitation, and, just a lot of bells and whistles in the background, which, I don't, that's not my call.
Let me go back when you arrived, though. Did you have an understanding when you got to the hospital that she was at dialysis?
I knew that she had dialysis at one point in the day. I don't know exactly where that lined up in the time frame, but she was not in the room when I got there at 3.
When she got to the room, were you able to talk to her?
So I was able to see her. I did talk to her. There wasn't too much back and forth communication initially. So I didn't really sense what was going on.
And was she on any monitors?
Yeah, she was on quite a few. I know that I'm not a medical professional, but I've been hooked up a couple times. So blood pressure, temperature, heart rate, those kind of things.
And you understood that she was in the cardiac care unit?
Yeah, ICU or CCU, right?
And you mentioned before when you testified bells and whistles. What did you mean by that?
Well, I mean, you hear the alarms going off. I don't know what they mean. Usually, when an alarm goes off in anything that I do, it's attention, right? Quite a bit, enough to get me kind of out of the room because it was, not, I wasn't comfortable being in there because there was nothing I can do.
What did you do when you went out of the room?
Just trying to get a better understanding of what was going on. So, living with a bunch of nurses, my wife, my daughter, a lot of people around, there's usually a plan, right? With, a care plan or something like that. So, I was told many times, you never yell at nurses, you never yell at doctors, there's a plan. So I, tried to do my best to investigate what the plan was.
And, you walked out into the hall, what did it appear that was going on based upon your observation?
Based on everything that I saw was, that they were, that the plan was to, that they were waiting for somebody else to make the decision, right, on what to do. And, I thought to myself, it's tough to, take that because, we're waiting for a decision. I'm thinking the hospital has a bunch of doctors in it, but, nobody was making a decision, and that went on for quite a long time.
From the time you arrived at the trial point at o'clock until you left,
Yes, my brother and I were in the car right behind the ambulance the whole way. And my niece.
so from the time you got there to the time you left, did you see a doctor go in your mom's room?
The only doctor that I saw was the one that administered an IV because none of the nurses were able to get the IV in.
Did you ever talk to her that?
Never.
Did you have any knowledge that the doctor was taking care of you on
No, and that kind of is what stimulated most of my frustration because, again, I was there for 3 to 4 hours with nothing, right? No information, no, here's what's going on, no plan. So,
Did there come a time when the situation changed and they decided that here was your mom, something that happened with your mom? Strike that, let me ask you that. In the jury that you were sitting there from 3 to 5, not what you told us already.
right.
Did anything else happen?
Yeah, I mean, there was definitely a pivotal moment, and I remember it specifically. And during, again, I know when nurses work, but it was right around shift change, and it was a new nurse. There were nurses that went in, but this was a new nurse. And obviously they changed their name up on the board. We've all seen that when a new nurse comes in. So obviously it was a shift change. When that nurse started looking at the, the sheets and all of that to get an update on the patient and stuff like that, things changed, right, rapidly. I think that's, again, when that one physician came in because they had to get different medicine or something like that, maybe to stabilize, but really nothing happened until that nurse came in.
Transported to the University Hospital.
Correct. like I said, after that shift change, I mean, it was like, all of that activity that I was waiting for between 3 and 6 happened within, it probably wasn't, but it felt like 10 minutes, right? Everything that, you would expect to happen during that period of time pretty much all happened at once, right?
You still saw them in that.
No.
Nobody at that point was telling you that you were going to transfer your mom.
I don't think,
I'm sorry. You did not have any expectation.
I didn't know that was going to happen. Because I didn't see any change, like real change in her, right? I saw change in activity around her.
How was your mom going for the night?
What's that?
How was your mom going for the night? Did you observe?
Again, I didn't see any physical change with her. I didn't see any physical change. Again, I'm not a medical expert, but bells and whistles at 4 o'clock, bells and whistles at 6 o'clock, right? I didn't see any. It's not that stuff stopped.
So, your mom gets transferred, you mentioned you went with your brother to University Hospital.
Yep.
What happened at University Hospital?
So obviously we didn't, get to see everything that happened, but we kind of were in the waiting room while they were probably assessing and figuring stuff out there. So that was, maybe an hour, 45 minutes, and then we immediately saw the doctors once they had, figured everything out. Sure, they probably worked on stabilization. I don't know what they did, but we did get to talk to the doctors pretty quickly at UH. Yes. Yes. Again, that was, something that I remember pretty clearly, right? Just that conversation. When your blood pressure, it's blood pressure, heart rate, one drug increases, and if it goes too high, then, you're pretty much trying to treat the patient with blood to get the heart rate, blood pressure equalized, right, to a normal position. And that takes, it's like anything else. It's like, anything else that you can do that you're kind of balancing takes time. The doctor told us that that's one thing that they don't have right now is time. So, he mentioned, what's that?
Sustained, go ahead. The objection is sustained, go ahead and ask another question.
You need to, again, tell the jury what you observed, not what people told you. Okay?
Sure. Sorry about that.
Continue with what you observed.
So just, conversations, I observed there were probably 10 people in the room working, doing the assessment and, in that room with my mother, right? Versus, nothing before. So that was eye-opening. We talked to two doctors, right? When they came out to kind of give us the download. So I observed care, for lack of a better word. I observed,
You mentioned the decision, what was the decision?
the decision that we had to make was, again, do we balance it with, drugs, or do we, do the electrical stimulation, right, to get her heart into rhythm, into all that, so they can complete the stabilization, right? Because it's not a good position.
At that point, did you feel like you had a choice or decision?
Based on everything that was going on, the decision was clear. That was the route to go with because of time. Electronic stabilization, I don't know what it's called, but like where they shock your heart into rhythm.
Tell us what your mom was like at that point.
I'm sorry?
What was your mom like at that point that you?
So we actually got to go in and see her quickly before that. There wasn't any big discussion, but I think we visually saw her, and then my brother and I went for a walk because I didn't want to be around that situation. I wanted to be just stay moving. So
After the cardioversion, after the shock treatment, you saw your mom?
I don't recall seeing my mom after the cardioversion. I remember getting a phone call from my niece saying that we have to come down. She coded. Right?
You left UH?
No, we didn't leave UH. We just went for a walk outside of the intense area.
Why don't you tell the jury what you observed, what your experience was like, the remainder of your time staying in UH?
So after they, resuscitated her, they did not bypass, but they put stents in to open up the pathway. I remember, that happened later in the night. We're talking, probably 2 o'clock in the morning, or so. We're at that point, 2 or 3. After that point, there really wasn't too much communication. She squeezed my hand at one point when I was in the room with my sister, and I read her a poem that I wrote. So that was pretty much it. So I wrote 2 poems. You might be thinking of the one that's etched on her gravestone. I wrote that one when I was 19, when I was in college. I wrote her a poem that night while she was in getting her stents put in. Yep. Yes. It was the next day. Because I remember I was exhausted. I mean, I was up for over 24 hours. And I went home and tried to get a couple hours of sleep, came back to the hospital, and she passed later then. No, I was in the lobby, in the waiting area. I think my daughter was. No. It's tough. I mean, we all know that, life is fragile, right? And, we always, think of it like that, but, we only hope to have a chance, as many chances as possible, right? For me, it's been tough because, I always think I could have done more. I can't do anything. I'm not a doctor, but you just think what could I have done more? So that's tough. Obviously, not being able to say goodbye, and that can't get that one back. So it's been tough. It's 6 years or so already, and I think about her every day.
All right, cross-examination.
Good afternoon, Mr. Willis.
Good afternoon.
My name's Tim Spirko. We've had a chance to meet before.
Yes, we have. How are you doing? Pretty good.
The good news is, we've gone over your mom's medical history. We spent a lot of time going through that again. But there are a few things. So you saw your mom on a regular basis, right?
Yes. Yep.
Do you recall her losing weight?
Do I recall her losing weight during what time period?
Let's say between 2017 and 2018.
I don't know if it was 2017, but my understanding is with dialysis you lose weight, right?
Do you have an idea of how much weight you lost?
No, not particularly, but I know that when you go on dialysis, you lose quite a bit of weight because it increases the efficiency of your organs.
She started dialysis in 2016, right?
Yeah, I think in the spring.
Spring.
Yeah.
John, can you bring up exhibit I, page 58, please? This is a record from Dr. Dingra.
I can't see it, but
We'll get there.
okay.
This is a record from Dr. Dingra. Do you know who that is?
Hold on, did you say this is I?
Yes.
Okay, go ahead.
Can you repeat that? Sorry.
This is a record from Dr. Dingra.
Huh?
Do you know who he is?
It's one of my mother's doctors.
Do you know that he was a nephrologist?
If that's diabetes doctor? Yeah, okay.
This record is from August 10th, 2017. John, you can blow up the top part to show everybody. So this is about a year and a half after she's already been on dialysis. Right? Yes.
Yes. Well,
I'm sorry, you just have to say yes.
right.
Does it work?
Okay.
This is from August 2017. John, if you can blow up the block in the middle. This indicates that her weight at that point was 171 pounds. Right? See that?
I see that. Yes.
John, if you could bring up exhibit C, page 439. Again, blow up the top part so we can see what it is. This is the record from University Hospitals when she was admitted on September 26th, 2018.
Okay.
So that middle part, John, under general health. Blow that up. At that point, her weight is 138.8 pounds. See that?
I do.
So in that time period, she has lost 32 pounds.
Okay.
Were you aware of that?
Was I aware that was 32 pounds?
Were you aware she had lost weight during that year?
I mean, like I said before, when you go on dialysis and you're on dialysis and you have a good diet and you limit your liquid intake, you do lose weight. So yes, I do remember her losing weight.
But as a non-doctor, you can't tell us that's the reason for her weight loss, can you?
Well, of course, I'm not a non-doctor, but I know that with discussions with my mother or discussions, and things that I did to educate myself on diabetes, is that I know that there are certain foods that you can eat, there are certain foods that you can't eat to help your body function.
Reality is, David, you're not a physician.
I am not a physician.
In terms of the reason for this 32-pound weight loss of a year, after she had already been on dialysis for a year and a half, you can't say the reason for that, can you?
Can you?
I'm not
You got to answer the question.
Oh,
I'm not
that was a question. No, I can't. For certain.
John, actually, you pull up exhibit W, page 1681. Do you recall your mom during this time of weight loss that she was frail?
What were the dates?
So the dates were from August of 2017 through December of 2018.
Can you define frail?
All right, listen.
Well, I'm trying to answer.
Hold on.
You
gotta answer his question. If your lawyer wants to clear something up, he'll let Chance get up and do that, okay? All right, go ahead.
You recall your mom being frail.
No.
You can blow up heart under physical exam. This is a note from Richmond Hospital from June 17th of 2018, 3 months before she was admitted into TriPoint. And the physician on his physical exam describes her as a frail Caucasian woman, seen sitting in a chair, alert and oriented times 3, NAD during encounter. And under respiratory, he says, patient seen breathing with assistance of supplemental oxygen by a nasal cannula. You recall your mom having those problems?
I recall my mother going to, you said this was at Richmond Hospital? Yeah, I recall my mother going to Richmond Hospital for a breathing episode.
My question was, do you remember her having these types of health problems
Well,
back in June of 2018?
no, I was answering the frail question. I do remember my mother going to the hospital in 2017. At Richmond Heights Hospital, yes, emergency room. I do recall that. I saw my mother the day before that. I wouldn't describe her as frail.
You wouldn't describe her as frail, but the doctor did, correct?
Objection, Your Honor, sustained.
Just want to clarify, on September 25th, you said you arrived at the hospital around 3 o'clock.
3:30.
You said your mom wasn't in her room at that time?
I don't recall she had been transported back to the room at that time.
Did you ever see her come back to that room?
Again, I was waiting in the CCU.
At 3 o'clock?
I wasn't in the room. There was a waiting area right outside in the, at the end of the hallway, and her room was the last room in the hallway. So I wasn't in the room.
My question is, what time? At 3 o'clock? You waited outside the CCU room at 3 o'clock?
Well, I never said 3 o'clock. I said between 3 and 3:30. I don't have an exact date, exact time, but it was during that time frame that I was physically at the hospital. I don't recall what part of the hospital I was in, but my arrival time was between 3 and 3:30.
After you arrived, do you remember your mom being in one room and then being transferred to a different room?
After I arrived, I do not remember a transfer of rooms. Again, I arrived and I went to the cardiac care unit.
Well, I'm just trying to figure this out myself. Does the records reflect your mom was transferred from one room to another at 5:30?
Can I see that?
You were there at
answered that,
I've,
hold on, he's answered that, no, he doesn't, so let's move on from there.
I mean,
Hold on, we'll wait for another question.
How long your mom was at University Hospital, between the time she arrived and the time they did the cardioversion?
well, I don't know if I know exactly the time, but what I can kind of relate to is that there was a period of time that they were assessing her. Let me finish. That they were assessing her.
Hold on, let's, his question is, do you know how long you were there until the cardioversion occurred? If you don't-
After the assessment,
No. It's a question when he got to UH, how long he was there till the cardioversion occurred. Answer that question. If you don't know, then you can say you don't.
okay. Based on my memory, I would say it was probably about 35 to 40 minutes.